Loud and clear, Jenny?
Yes po, ma'am.
So to our Central Luzon, most especially the provinces of Aurora, Bataan, Bulacan, Tarlac, Angeles City, and Olongapo City, contact tracing teams, our DILG officers, PDs, CTLs, program managers, MLGOs, CMLGOs. Our partner and friend, Ruben Lim. Of course, palaging kasama natin si Ruben, and we're very thankful for always being here for Region 3, most especially in the orientation of contact tracing teams, our friends and partners from the city of San Fernando, ang ating mga palaging kasama ng mga doctors, at ang ating resource person from, I think we have from the Reso. Meron tayo ngayon nakasama natin. Why we're doing this? This is batch 1 and tomorrow will be batch 2 for the other provinces because we want Central Luzon to be slowing it down and decreasing the cases of those who are having positive cases in the different barangays. Ito ipagtulungan natin because even if we will do so many localized lockdown, if the contact tracing procedure and activity is not well and it's not well implemented, mahihirapan po tayo because when we say we do contact tracing, we have localized lockdown, time is of the essence. Ibig sabihin po yan, will it be 24-hour, 48 hours, dapat na arrest, nakita na natin ang mga taong who had close contact with this person, so who gotten positive with the virus. So kailangan talaga na maagapan so that the contagion will be decreased or lessened. So ang role ng contact tracing team ay napakahalaga at this moment, and we have to know for ourselves that we have a duty to perform. Pag tayo member ng contact tracing team na certain municipality, by all means we have really to execute, we have really to perform. At ito hindi mahirap po. Alam natin na napakadelikado, alam natin na talagang it takes a lot of risk on our part, but we as public servants, tayo na sa gobyerno ay talagang anuman ang mangyari ay talagang gagampanan po natin ang ating mga trabaho na ibigay sa atin. That's why we're having and initiating this orientation so that the risks surrounding the conduct of contact tracing will be eliminated. Alam natin the do's and don'ts, alam natin paano natin i-secure din ang ating kaligtasan, ang ating health by doing all those minimum health protocols. So this afternoon is very important, lalong-lalo na nag-MC, nag-MECQ na yung Metro Manila and 4 provinces, 3 in Calabarzon and ours, Bulacan, of course. So tulong-tulong po sana tayo. We need to be very serious with this pag-contact tracing. First, we have to secure the safety of the contact tracing teams. I know mahirap itong gawin, nasa field, but sa tulong ng ating Panginoon at ang ating tamang pag-aaral at ang tamang orientation sa atin, magagampanan po natin ng matiwasay ang ating mga dapat gawin. At sana po, stay safe, healthy, habang ginagampanan natin ang naibigay sa atin na katungkulan sa ating mga bayan-bayan. Kaya kami nagpapasalamat sa ating mga resource experts ang magtuturo po sa atin ngayon, at pag po kayong mag-atubili ng magtanong para maliwanagan lahat ng mga hindi malinaw sa atin pananaw kung paano talaga gaganatin ang isang contact tracing sa isang lugar. I know that we've been doing this thing, contact tracing, mula pa noon kung how many months na tayo, but we need really to look at ano ba talaga at totoo dapat ang gagawin natin. Iwasan natin ang dapat gawin. So, thank you so much. We have at present 188 participants. Or very much to our LGU functionaries. Thank you so much, the ILG officers, staff personnel, and thank you so much to our resource experts and the initiative coming from the Monitoring and Evaluation Division under the leadership of course, Larry and Alduin and the staff. So, magandang hapon sa ating lahat. Enjoy the training as well as we hope that everyone will benefit and the training, the orientation will be very productive for all of us. Thank you, everyone. Have a safe afternoon.
Thank you so much po for that message, RD. So sabi nga po ni RD, wag po kayo mag-atubiling magtanong. So for your questions po, just send them in our chat box. To quickly proceed with our orientation, our first speaker to discuss the quick guide on the contact tracing reporting template is from the ILG Central Office Disaster Information Coordinating Center. Sabi nga po ni Sir Edwin, the Queen of Codex, Mr. Robin Lim. I think Sir Robin po is just sharing po his screen for his presentation.
For a moment, Janie, konting technical difficulties lang.
Yes po, no problem, sir. So habang pong hinihintay natin si Sir Robin, please accomplish our attendance sheet because dun po namin kukunin ang names for your certificates of participation. And for those po who might be accidentally na-unmute ang kanilang mic, please ensure po na i-mute po natin siya throughout our discussion.
Right. Thank you very much, Janie. Good afternoon po, each and everyone. Good afternoon po, RD Julie, Ma'am Larry, and the DILG team, and to our LGUs. Pasensya na po at ako ay nauna dahil may kasunod pa po akong engagement. So, I will be discussing to you on how are we going to accomplish the new the harmonized and revised contact tracing report template. So this will be a 30 minutes presentation lang po. So this is our outline of presentation. As you can see, we will be discussing the rationale, the key changes, the template itself, the indicators, and of course, the navigating of the template, and lastly, reporting of ROFs and LSIs. For our rationale, the Department of the Interior and Local Government, in coordination with the Department of Health Epidemiology Bureau, we have came up with the revised harmonized contact tracing template. So basically, ito rin po ay nanggaling sa mga recommendations ng ating field officers sa ating mga local government units, no? The revised and harmonized contact tracing report template will further streamline the monitoring and reporting of the contact tracing. It will be the template is a more functional and easier to accomplish, and of course, the use of COVID Kaya application as the data capture tool. Now, here are some key changes in the new format. first we have removed the general contacts, no, yun sa first portion. Hello, Jenny, can you hear me?
Yes po, Sir Rob.
All right.
Clear naman.
Thank you. First, ni-remove po natin yung general contacts. This is to give emphasis for the contact tracing teams to focus on tracing and assessing all the close contacts na lang po. Ito yun tinanggal namin para ma-unload po, para matanggal po ng additional time for the contact tracers to encode and to validate, no? Next is the addition of the cumulative number of close contacts listed. Ito yun wala dati dahil na we need to get all the total universe of the close contacts listed para makita po natin kung amongst the close contacts listed, ilan pa po doon yung hindi natin nako-contact trace. So, this can also serve as an indicator to monitor the performance of the contact tracing teams. Next is, we also added the subcategorization of the close contacts into asymptomatic and symptomatic under the disease case classification. This is, of course, to account all close contacts which were not present in the previous templates. Kasi po, when we were doing our data mining, when we were trying to balance things out, hindi namin mabalance yung mga close contacts. Kumbaga, hindi po namin na-account lahat. So with this additional categorization, subcategorization, we will be able to account everyone na po. Next is the addition of management and outcomes of close contacts to include the recovered and the deaths, and of course, the completed 14 days mandatory quarantine. This is as well for us to know and understand on how to check on all close contacts were properly accounted. And of course, we have the improved technical notes. No? This includes a more detailed technical explanation on how each indicator is correlated to one another and providing simple equations to account and balance the close contacts. So we can do cross-checking na rin po dito. Now, this is the template, no? Just quickly, the template is divided into three parts, no? Ang first dito is the organization of the contact tracing team. The second part is the contact tracing of confirmed cases, and third po is the close contacts. All right? So napansin nyo rin po sa taas ng template, meron po tayong nilagay na column numbers, no? Because this will serve as our guide later on how to balance the equation. Can you excuse me for a moment? Jamie, can I reshare my screen?
Sure po, Sir Rob.
Okay, pasensya na po. Jamie, can you now see the screen again?
Yes po.
All right, thank you very much. Pasensya na po ulit. Now, so again po, no, the new contact tracing report template is divided into three: the organization of the contact tracing teams, the contact tracing for confirmed cases, and close contacts. So sa taas po nito, may nilagay po tayong mga columns, mga letters, para later on we can do the simple equation to account the close contacts and to include the confirmed cases. Now, first po, under the for the part 1 of the contact tracing report template, which is the uh, organization of the contact tracing team, kung napansin nyo rin po sa slide, meron po kami nilagay na indicator whether the data is cumulative or a moving data. Now, under the organization of contact tracing team, first in line, we have the number of teams organized. No? This refers to the cumulative number of organized contact tracing team. Each city municipality is enjoined to organize the corresponding number of contact tracing team commensurate to its population. Next is we have the number of members. So this refers to the cumulative number of individuals in the contact tracing team. So kindly refer to the DILG Memorandum Circular 2020-077 because this provides the guidelines and the composition of the team. And of course, the number of the teams may vary po according to the availability of the personnel. Next in line, we have the number of members trained. So among sa mga teams po natin, ilan po dito yung na-train natin. No? When we say training, these were oriented by the Epidemiology Bureau or the regional city, municipality epidemiology surveillance unit. Or naka-enroll at nakatapos po sila sa contact tracing course being conducted by the local government academy in coordination with the Department of Health. And of course, doon sa mga umattend po ng mga unang training natin under the UP College of Nursing or even kung naka-attend po kayo sa listong ugnayan session on contact tracing. So that is for the first part of the template. Now let's proceed on the second part of the template, no, which is the contact tracing for confirmed cases. So first in line, we have the cumulative number of confirmed cases. So this refers to the total number of laboratory confirmed COVID-19 cases. Again po, laboratory confirmed COVID-19 cases. Ito po yung mga nag-undergo ng RT-PCR. Just a note lang po, the data sources would not automatically be generated from the contact tracing team. So, hindi lahat ng confirmed case natin ay nanggaling sa ating pagkakandak ng contact tracing. Kasi po, meron rin tayong ibang confirmed case na nanggaling sa returning OFWs and locally stranded individuals. Next is we have the cumulative number of confirmed cases traced. So this refers to the cumulative number of confirmed cases which have been successfully traced. When we say successfully traced, ito po ay na-locate na natin at na-interview po natin sila. And of course, we have the percentage of confirmed cases traced. This can also serve as one of our indicators on the performance of the contact tracing teams. Next is we have the cumulative number of close contacts listed. So this refers to the number of close contacts of a confirmed case who have been listed. So the list may be generated by interview of a confirmed case. So yun mga kinakausap natin na confirmed case, di ba po ba nililista po natin kung sino-sino po yung close contacts niya. So we need those lists para makuha po natin yung total universe natin. All right. Next is after we got the list of the close contacts, ang next na kailangan pong gawin natin is to get the cumulative number of close contacts traced and assessed. So, Ang ibig sabihin po nito, sa mga nalista po natin na close contacts, ilan po dito yun na interview na natin at na-assess po natin. When we say assess, ito yung mga close contacts na na-interview na po natin either via phone and other messaging application or pwede rin po face-to-face as long as we follow the minimum health standards. And the health status and disposition were determined. Alright? So, basically po, lahat ng data nyo galing dito would be coming from the cumulative number of close contacts listed. Next is we have the percentage of close contacts traced. So, Jamie?
Yes po, Sir Rolf.
Nawala ko ba yung pag-share ko ng screen?
Yes, ibang screen yung nag-appear, then
Okay.
nawala na po siya.
Let me share again. All right. So next we have the percentage of close contacts traced. So this refers to the percentage of the cumulative number of close contacts listed which have been successfully traced and assessed. This could also serve as our performance indicator ng ating contact tracing teams. Kasi po, amongst the listed, ilan na po doon yung na-contact trace natin. At ang sinasabi po natin, dapat po lahat ng close contacts ay na-trace po natin within 24 hours. Next is we have the case-to-close contact ratio. This ratio refers to the number of close contacts traced and assessed against the total number of confirmed cases. So, ang ibig sabihin po, kada isang COVID-19 confirmed case, ilan po yun na generate niyang close contacts. However, please note that this ratio is not definitive. It may depend on several factors such as ongoing community quarantines, type of area, urban ba ito or rural ba ito. So, depende po, case-to-case basis po talaga ito sa bawat local government unit. Next here, we have the new indicator, which is the management of outcomes of confirmed cases. So dito sa management and outcomes of confirmed cases, we divided it into two. First, we have the confirmed cases still in isolation or quarantine and kung ano po yung outcome nila. Alright? So let's go first with the first indicator here. First in line is we have the non-health isolation facilities. So this is a moving data po, and this refers to the confirmed cases who are in isolation in the non-health facilities. When we say non-health facilities, this is also known as the temporary treatment and monitoring facilities, or also known as the ligtas COVID-19 centers. So again, these are for confirmed cases who are asymptomatic or with mild symptoms. So yung data po dito, this can be moved to the health facilities or referral hospitals or sa outcome naman po kung namatay or na-recovered po siya. Next is we have the still in the next indicator, which is the health facilities and referral hospitals. So these are for symptomatic confirmed cases confined at any referral hospitals po, or in any or in any ligtas COVID centers which are accredited by the PhilHealth or certified by the Department of Health. So, yung data po dito can be moved to a non-health isolation facility kung medyo gumaling na po ng konti yung ating confirmed case, pwede po siya ilagay sa step-down facility. Or sa kasamaang palad po ay namatay po siya. Or sana po ay naka-recover po siya. Ito naman po, let's go to the outcome, no? So, doon sa previous na indicator, yun po yung number of confirmed cases who are in the isolation facilities. Now, ano po ba yung mga pwedeng outcomes nila? Dalawa lang naman po.
Ay, nasa.
It's either na namatay po siya or naka-recover po siya. When we say recover, please refer to the Department of Health, Department Memorandum Circular 2020-0258. Now that ends the second part of our template. Next, we will go on the third part of our reporting template, which is the close contacts. So dito po, medyo nag-expand po tayo ng konti. Now, in this template po, we have divided it into three. First, the disease case classification. Second, the management and outcomes of close contacts. And the number of close contacts tested. I would just like to emphasize na si disease case classification ay may sarili po siyang universe. And si management and outcome of close contacts ay may sarili rin po siyang universe. Alright? So let's discuss on the disease case classification. Under the disease case classification, we divided it into two categories, which are asymptomatic and symptomatic. Under the asymptomatic, ang first po dito is for close contacts who were not tested or waiting for results. So this refers to the current number of asymptomatic close contacts who were not tested but are waiting for results. So just a quick backstory po. Ito po yung missing link sa unang template po natin na bakit hindi po nagbabalance yung mga close contacts because hindi po natin na-account yung mga close contacts na hindi pa po natetest or waiting for results pa lang po. So, this data can be moved to a negative RT-PCR test or sa equivocal na results po. So, next in line, we have the negative results for asymptomatic. This refers to the current number of close contacts traced and assessed who were tested with RT-PCR and the results was negative. However, this can be moved, yung data dito, this can be moved to a probable or to a confirmed COVID-19 case under asymptomatic or symptomatic. Next is the equivocal na results. This refers to the current number of close contacts traced and assessed who were tested with RT-PCR and the results was equivocal. Equivocal means that the result is not clear if it is negative or positive. Usually po, nakalagay po talaga ito sa RT-PCR na results. The data here can be moved, These cases may be retested and subsequently recategorized as confirmed or they would remain as probable later on. Next naman po is we have the confirmed cases. So again, this refers to the current number. This refers to the current number of close contacts traced and assessed who were classified as asymptomatic case. May guide questions po tayo dito that para hindi po tayo makalimot, you just have to ask yourself is, who amongst the close contacts traced and assessed, how many were categorized as confirmed 19 cases through RT-PCR? And another note here is that kung ano po yung results dito, the number of confirmed COVID-19 cases here in this category should be added to the number of cumulative confirmed cases. Alright? Para po, babalik po tayo sa cycle na i-contact trace po siya. Next is, we have the sa symptomatic naman po. No? First, we have the suspect. This refers to the current number of close contacts traced and assessed who develop signs and symptoms that fit the case definition of a suspect case. No? As flash on the screen, ito yung mga nag-fit po ng case definition ng suspect as per defined by the Department of Health. Next is, by the way, yung suspect po, this can be moved into probable or confirmed case pag nag-yield na po siya ng results. Next is the probable po. This refers to the current number of close contacts traced and assessed who fit the case definition of a probable case. Ayun. So, dito po, pag hindi po siya naging confirm, no? Pag naging negative or hindi po siya naging confirm, i-maintain lang po natin siya sa probable na category, no? Ayun. Next is for the confirmed cases, no? So this refers to the cumulative number of close contacts traced and assessed who were categorized as confirmed cases. So again po, yung mga numbers po dito under the confirmed case should be added into column letter E para po masimulan po natin yung cycle ng contact tracing. Next in line, we have the did not fit case definition. So nalaman po rin namin sa previous na template, kaya hindi rin po siya nagbabalance kasi may mga close contacts na symptomatic pero hindi siya nag-fit sa case definition ng isang suspect, probable, or confirmed case. Ayun. So kung napansin niyo po, under the disease case classification, yung total universe po dito would refer to the total number of close contacts traced and assessed. Mamaya po, may ipapakita po akong equation. Next part of the template is the management and outcomes of close contacts. First in line, we have the, of course, the management and outcomes is also divided into two subcategories. So, first is the close contacts still in isolation or quarantine, or ano po yung outcome niya, whether namatay siya or nakakomplete po siya ng 14 days quarantine. Now, first in line is we have the home quarantine. So, this refers to the close contacts who are asymptomatic na naka-home quarantine, no? Except for confirmed cases. Kasi po, yung mga confirmed cases po natin ay nailagay na po natin siya sa column letter L at letter M. So doon na po yung pagmamanage sa kanya. So note lang po sa ating mga local government units that LGU should ensure that the close contacts was able to fulfill the criteria set in the joint admin order for him or her to be allowed to only undergo home quarantine. And of course, yung data ng home quarantine can be moved to the non-health isolation facility, health facilities, or referral hospitals, or pwede rin po siyang namatay or nakakomplete po siya ng quarantine. Next in line is we have the non-health isolation facilities. Again po, This is only for close contacts who are asymptomatic and suspect, probable, and did not fit case definition. Yung mga confirmed cases po, wala na po siya dito kasi andun na po siya reflected sa column letter L. So, again po, just a reminder, yung ating non-health isolation facilities are also known as the temporary treatment facilities or the local COVID-19 centers. Next in line po, we have health facilities or referral hospitals. So ito yung mga close contacts po natin except for the confirmed cases who are confined in the hospitals po. So this is only for suspect, probable, and did not fit case definition. Next here, we have kung yung outcome ng isang suspect, probable, and did not fit case definition. Kung namatay po siya. Except for COVID-19 confirmed cases. Kasi po, itong confirmed cases, andun na po siya sa column letter N. Next is we have the completed quarantine. No? This refers to the cumulative number of close contacts traced and assessed who completed the mandatory 14 days quarantine, whether at home or in a facility or hospital. So, ayun po, no? Lastly po, under the second part of the template is we have the completed quarantine. So sinasabi po natin dito, based doon sa bagong definition ni DOH, no, meron po tayong mga categories on how to determine if the suspect, probable, or did not fit case definition, or for asymptomatic, who are qualified to be categorized in this indicator. So, first in line is if the close contact is a suspect case who tested negative or is a probable case and is in a non-health isolation facility or referral hospital, their outcome shall be categorized in this indicator after discharge from the facility. If the close contact is a suspect case who tested negative or is a probable case and remained in home isolation, their outcome shall be categorized in this indicator after laboratory results has been released. Next here is if the close contacts were not tested but finished the 14 days quarantine period in the non-health isolation facilities or health facilities or in a referral hospital, their outcome shall be categorized in this indicator po. Ayun. If the close contacts absconded or tumakas po siya, additional remarks may be added as necessary. Now, on the third part of the template, we have the number of close contacts tested. No? Under this category, we have divided this into two, the RT-PCR and the RDT. First in line, we have the sa RT-PCR. So this refers to the total number of individuals of close contacts traced and assessed who tested using RT-PCR. So this should be equal or less than column letter I. Mamaya po may ipapakita po akong equation. Next is the amongst the number of close contacts traced and assessed who tested via RT-PCR, ilan po dito yung nag-test ng positive. Next rin po dito is for those LGUs who are using the rapid diagnostic test or yun sa yung RDT. First is ilan po ba dito yung nag-test, no? The total universe of the close contacts traced and assessed, ilan dito yung tinest natin. So again, this should be equal or less than column I. And lastly, among the close contacts traced and assessed tested via RDT, ilan po dito yung nag-yield ng a positive for IgM only using RDT. This is based on the DOH protocol on the expanded testing because only those who are IgM positive only shall be tested using the RT-PCR. Now we're done with the template. Let's quickly navigate. So first is, ito po, no? Column F should be equal to the sum of L, M, N, and O. Kasi po, sa lahat po ng, this is one way for us to account to account all the confirmed cases traced. Kung gusto natin sila ma-account, dapat mag-equal po siya dito. Kung may kulang po or may sobra, ay kung may kulang po, meron po tayong na-miss out. Kung may sobra po, meron tayong talaga, hindi na-account. Next is the column H on the number of close contacts listed should be equal or greater than column I or the cumulative number of close contacts traced and assessed. Kasi po, column H would give us the total universe and column I would tell us ilan na ba doon yun na trace at na-assess po natin. Next is, ito po, the sum of columns S and V should be added to column letter E. But the sum of S and V should not be equal or greater than column E, as there are other sources of sources of infection or cases po, such as the returning OFWs and the locally stranded individuals. Next po dito, if we want to account all the close contacts traced and assessed under column I, this should be the sum of columns P, Q, R, S, T, U, V, and W should be equal to column I. So ayun po, no? Para ma-balance out po natin. Para lahat po ng close contacts traced and assessed ay na-properly account po talaga natin. To balance out under the close contacts, no, the sum of X, Y, Z, AA, and AB should be equal to the sum of P, Q, R, T, U, X, and W. Hindi ko po sinama yun columns letter S and letter V, victory, kasi yan po ay andun na po sa confirmed cases natin. Next po is the columns A, AC, and AE, individual columns po ito, should be equal or less than column I. Because this would also give us the total universe of the close contacts traced and assessed who were tested. All right? Now, let's go to the reporting considerations po, no? Ito po yung mga naging mga issues natin in the previews. As a general rule, contact tracing should have no boundaries. A contact tracing team can use the phone or any other means of communication at their disposal. The contact tracing team from one LGU may seek the assistance from another LGU in determining the location of or obtaining information about Hindi pa-mute naman.
Pero yung pupunta ko ba or okay. Ganito ba for peace of mind na din para wala
Hello?
tayong pang-bang? Or tayo naman
Yes po, minumute na.
Sa AMH po, kasi ay doon, meron kayong mga nagiging kasabay na pagkakatian ninyo yung bayan. Kasi pag dito ma'am, wala kayo magiging kakasya. Pag hindi namin kayo, wala din magiging sayang. So, ganun na lang.
Ayun.
Para walang, kumbaga walang magiging sa risk natin.
Alright, sige po, let me proceed na lang po, no? So, again po,
secure na siya, yung 3 doses. Kaya ngayon po yung initial, tapos yung schedule na na, tapos isa pa.
Ma'am Amy, sorry, hindi pa kulaw. Paki-unmute po.
Sa side.
Nag-feedback. Ayun. Okay, thank you very much. Again po, the contact tracing team from one LGU may seek the assistance of another LGU in determining the location of or obtaining information about a close contact. For recording and reporting purposes, even if the close contacts are residents of an LGU outside of the official jurisdiction of a concerned contact tracing team, the close contacts shall be counted and the information about them reflected in the report of the concerned contact tracing team unless the concerned contact tracing team officially endorses the close contacts to another LGU. In which cases, the LGU endorsee shall count and reflect the close contacts in their own contact tracing report. And the endorsing LGU will no longer include the close contacts in their own report. Ibig sabihin po nito, yung example po, yung contact tracing team under sa Bulacan at sa municipality of Bulacan, meron po siyang na-identify na confirmed case at meron siyang na-identify na close contacts listed. So, if the LGU of Bulacan would want to trace and assess the close contacts from another LGU, kasi po, 'di ba, na-identify niya na yung dalawang close contacts ng isang confirmed case nila ay from Maykawayan. So ngayon, nasa kanya po yun. If he wants to contact trace that close contacts, yung report na yun, the figure should be reflected doon sa municipality of Bulacan. However, I would recommend option number 2. The contact tracing team of the municipality of Bulacan should endorse na lang po yung mga close contacts na listed sa Maykawayan po. Para doon na po i-reflect yung data. Next here is for the LSIs and returning overseas Filipinos, no? For the locally stranded individuals who are currently at Metro Manila or any parts of the country, prior to travel, they are required to undergo the rapid diagnostic test. If the results yielded positive IgM only, they will be subjected to RT-PCR. And if yielded a positive result, they will be quarantined in the area where they are currently located and be tagged in the LGU on where they are and will be allowed to live until their recovery. If the LSI if an LSI po arrive in the final destination and tested positive for COVID-19, kasi po karamihan ng LGUs, pag dumating po ang isang LSI, kina-quarantine pa po nila, no? So, papaminsan pinatest pa po. So, pag ganun po yung situation, they will be tagged at the LGU of the final destination. But contact tracing should be done by both LGUs contact tracing should be done by both LGUs of origin and final destination. Now, for the returning overseas Filipinos, no? Upon arrival po nila dito sa bansa, tinetest po sila. So, upon arrival and tested positive for COVID-19, they will be tagged as a separate group, no? They will be they should not be tagged under a region or under an LGU because it's the role of the Bureau of Quarantine to tag them. And sila rin po yung nagkakandak ng contact tracing. And of course, after they have been healed, the ROFs will be allowed to live until their recovery. But for the instances that they tested negative, no? Pagdating nila ng Pilipinas, nag-test sila ng negative. So, allowed silang bumalik sa kanilang probinsya. Then, pagdating nila sa kanilang mga respective na LGUs, ay nag-quarantine po. Tapos, nalaman ng LGU na nag-positive tong returning overseas Filipinos. So, pag nag-positive po siya, then, that ROFs, those ROFs shall be tagged as ROF at the LGU of final destination. So, si LGU na po yung magtatag sa kanila. Now, next here is the organization of the contact tracing teams. Kasi naglabas kasi po si DILG ng memorandum na yung barangay contact tracing team should be organized. Now, ang question doon, shall there be another reporting mechanism or those barangay contact tracing team shall be part of the shall count as one team under the LGU contact tracing team. Now, ito lang po on the organization of the contact tracing team, with the recent issuance from the DILGs, the LGUs are enjoined to create a barangay contact tracing team whose primary responsibility is to identify all persons with known exposure to COVID-19 patients and ensure that they strictly observe appropriate home quarantine measures or properly situated in a government-managed isolation facility and monitor their status. The LCE may follow the composition of the BHERTs, no, as provided in the previous DILG Memorandum Circular. 2003 pa po yun. Now, the LCE may also designate and in coordination with the municipal or city health officers with their respective lessons po to form part of the team. Now, ito po yung recommended composition ng barangay contact tracing team. Now, the question remains is, kailangan ba siyang i-separate na reporting? Well, no need na po, no? It is understood that in most cases, the barangay tanods and barangay health workers are already part of the city municipality, are already part of the city municipal contact tracing team. And their function stated earlier is only a reiteration to intensify further the contact tracing efforts of the LGU. Thus, there is no need for a separate reporting on the number of organized barangay contact tracing team, as they should be included in the additional members of the city municipality contact tracing team. Next is on the to further streamline the reporting system, no, especially on the utilization of a data capture tool, the COVID Kaya application was identified by the Department of Health as the information system for those close contact data and reporting of contact tracing. The COVID Kaya application can generate the data needed in the contact tracing reporting template. However, if yung LGU nyo po ay meron ng sariling application on the contact tracing, there's there's no need for you actually, but there's no need to use the COVID Kaya, but it still encourages though. Kung meron kayong established na sariling contact tracing application, it should be linked or it should be integrated into the COVID Kaya application. And this will be done by in coordination with the DICT po. Again, kung meron na po kayong existing na data capture tool similar to COVID Kaya, let's just integrate that doon sa platform ni COVID Kaya through the DICT. So if you want for a tutorial on how to use the COVID Kaya, you may check the link, no? I'll be giving out this presentation afterwards and you can click on the link para ma-direct po kayo doon sa video. Now, to summarize everything, no, to put it in one picture, meron po kaming dinevise na reporting flow. This would also serve as a guide for all of you at the local level to properly monitor, no, parang algorithm po ito kung saan ba dapat ang movement ng isang confirmed case at saan rin ba yung movement ng isang close contact natin. So this is a similar, this is a reporting flow chart that was based on the revised and harmonized contact tracing report template. So with that po, maraming salamat. That ends the presentation. Thank you very much. Janie, over.
Thank you very much, Mr. Robin Lim of DILG Codex. Now to move on po to the next presentation to share the best practices of the City of San Fernando, Pampanga. We have the City Health Officer of the City of San Fernando, Dr. Renely Pitungol.
Hello?
Hello, ma'am. Yes po, clear naman po yung audio.
Hello? Can you hear me? Hello?
Yes po. Yes po.
Ayan. Oo.
Very
Ay, putya. Oh. Good afternoon.
Good afternoon po, Doktora.
Can you hear me?
Yes po.
Yes po. I am tasked today to share our contact tracing practice here in the city of San Fernando. We don't claim it that it's a ironclad practice, but for us, it works for us, and maybe it will also work for your municipality. No, so contact tracing for us and for me is a skill. No, so every now and then you need to orient and reorient your contact tracing teams in order for them to acquire the skill and to share their experiences so that others could learn. Yan po, no? So, for the city of San Fernando, we had 4 trainings for among our contact tracing teams. Na our contact tracing teams are 41 in all. We have 35 barangays here, and we have a different contact tracing teams among establishments. No? So when you plot all the possible contacts, sometimes they go to these establishments or offices. So different contact tracing teams will go to these establishments. Now, to present my presentation, so for contact tracing teams, they are trained to look at the missing link, no? For us, we see confirmed cases, and this confirmed cases has close contact. Sometimes they don't know where they have been a week before, or their possible contacts. So we help them trench out all these possible close contacts so that we can assess if they are really on the definition of close contacts. So what happens to people after they get infected with COVID-19? So not everyone who is infected gets sick, no? So we all know this, that is why there are asymptomatic carriers of this virus, and not all the contact tracing teams should know how long the sickness lasts and what is the probable incubation when is the probable incubation period of this patient, so that we could trace back their contacts. So the signs and symptoms, no? So you have to ask all this, no? The signs and symptoms of that patient, so that you know how to trace back all those people that they came into contact with, and also with this signs and symptoms, also the close contact, no? It is very useful to ask also the possible signs and symptoms of those close contact of the confirmed case, most especially those who live in the same house of that confirmed case. Also, the signs are objective measurements to characterize illness during a physical exam. This is a respiratory disease. That's why you look at the breathing of any patient or that of their close contact. So if it's faster, so this is indicative of a respiratory disease. No. Now, for symptoms are what patients say about how they feel. No, medyo napapagod, nawawala yung pang-amoy, panlasa. No, so we all see this. No, so mostly among our patient in our isolation facility has loss of taste or smell. No, mostly.
Hindi, ano siya?
Hello, hello. Okay, so mostly they have loss of taste and smell. Okay, so we see this particularly almost a week after their uh, their exposure. No? So common talaga itong loss of smell. No? So the severe signs and symptoms, usually they progress, no? The first week of they have mild symptoms, while on the second week doon na nagkakaroon ng progressing, no? Napakabilis na afterwards. Doon sa second week usually doon nakikita if papunta ba siya sa moderate or severe, no? So as here in San Fernando, we don't have our own hospital. That's why we are very aggressive in looking for possible suspects, close contacts of confirmed cases, so that nasa mild pa lang siya na monitor na namin and nabibigyan na namin yung pampaboost ng kanilang immune system or antibiotics if necessary. Okay, so these are the symptoms of severe signs and symptoms, no? Blue lips of face, increased rate of breathing, shortness of breathing, chest pain when breathing, waking up during a sleep with shortness of breath, non-confusion or difficult waking up, no? So nakita namin to sa mga moderate to severe wherein they really have difficulty when sitting down and then they cough, no? Usually hinahabol talaga nila yung paghinga nila, no? So one way of equipping your contact contact tracing teams kasi sometimes kasi sasabihin ng seso nyo na may confirm case tayo, tapos hahanapin nyo siya. So you really need to see also, no, your contact tracing teams dapat merong medyo knowledgeable in terms of medical doon kasi they have to be assessed if they are mild, moderate, or severe, no? Kasi baka kailangan dire-diretso na pala sa hospital, lalong-lalo na kung meron siyang mga severe signs and symptoms. So sa CT scan, this what COVID lungs will show us, no? May mga opacities na ganyan, no? So pneumonia, no? Ang usually na doon sa mga moderate severe natin. Now, how COVID is transmitted, first way and second way, and there's third way. No? So the first way is an infected people have a virus in their mouth, nose, and throat, and droplets come out when they talk, laugh, and cough and sneeze. And droplets, sometimes they are micro droplets, no, that come after talking, laughing, coughing. They say talking out loud, laughing out loud, and coughing, no, can produce micro droplets. No, that's why may mga airborne precaution na tayo. No, so in an enclosed space, we have to quantify how many hours did they interact with each other, no? Kasi sabi nila, more than 2 hours with a confirmed case in an enclosed space, they are already considered close contact, no? So you have to be very careful in assessing those close contact, no? So for the second way, surfaces may have viruses for someone's respiratory droplets. So sabi nga natin, one of the infection control measures, washing hands or using alcohol, no? Kasi the person who has COVID-19 can transmit the virus dun sa mga nahahawakan nila because they have a tendency also to contamination of their hands with that of their mouth or that of their nose, no? So pwede pa ring matransmit. So tinitingnan din po ito lalo na kung kasama talaga sa bahay, no? So there is increased risk of those close contact nila sa bahay na magkaroon po sila ng COVID-19 because of this second way, no? So droplets can travel during sneezes, cough, talking, singing, travel up to 6 feet, no? So dun sa singing, no, so nakita nila in Korea we're in the choir, no, there is this choir wherein one person has a COVID-19 and kahit na yung mga medyo malayo sa kanya na bigyan because of the singing, no, kasi may mga micro droplets na napoproduce during singing or yun nga sinasabi ko nga yung medyo mas malakas yung boses nila, no? So yun yung nakita nila, no? So mask can reduce transmission kaya titingnan mo dapat if the close contacts na nakasalamuhan niya, if they're wearing masks or any PPEs for that matter para nare-lessen kasi yung risk of transmission when you have PPEs with you, no? Again, titingnan din kung may breach ng infection control na ini-implement nila sa bahay, sa opisina para ma-determine natin kung they are really close contacts. So people are infectious before they have symptoms, no? So we all know that now, no? So even asymptomatic, no? But the difference between symptomatic with symptoms is pag asymptomatic ka, mas less yung risk as compared dun sa mga symptomatic, no? So us here in San Fernando, our experience is yung mga with symptoms talaga are much virus spreader, no, kumpara doon sa mga asymptomatic natin, no? But meron din kaming mangilan-ngilan na asymptomatic talaga pero nakakapanghawa din siya ng mas madami din, no? Pero mas higit pa rin yung mga with symptoms, no? So So para sure ka, you have to really, hello? You have to really identify at itanong, no, paulit-ulit. You ask them if wala talagang symptoms. Kasi we have one patient, ang symptom lang niya is 1-day fever. No? So, and afterwards, that patient died. No? So, yun yung tinitignan nyo. Kasi minsan, pinagwawalang bahala nila, sinasabi nila na wala namang fever, pero kasi may mga excuses sila. So, you have to really seek the answer, no, sa kanila, ilabas yung totoong sagot sa kanila para talaga ma-determine natin. So, transmission is more likely with closer contact, no? So, physical contact. Kaya nga isa sa mga ano natin is physical distancing, no? So physical contact, close contact within 6 feet or 15 minutes or more. Sabi ko nga, more than 2 hours in an enclosed space, even if you have mask with you, both of you, no? May risk na yon, no, because of the longer that you come into contact with that person. Shared environment, shared food and bathroom, shared beds, no. So isang nakikita namin ito, no, among mga close contacts is the risk of getting the virus kasi pag nagkakaroon sila ng during break time, no, during sa offices nila. So they trust that their office mates doesn't have any COVID, kaya nagtatanggal sila ng mask during break time, or when they eat, no, they share food, no. So yun yung nakikita nila because they trust these people with them, or they are their friends, no. So even relatives minsan, no. So we have this one mass gathering wherein they celebrated the Father's Day, and nahawa 6, no, doon sa isang confirmed case, no. So ano talaga doon sa mga the duration and the activity that you are in that particular gathering, no. So kailangan yun din ang tinitingnan natin na pag nagko-contact trace tayo, no. So transmission is more likely between people who live together, no. So laging automatic, no, parang mag-asawa, no, syempre pag mag-asawa mas intimate, ano yung physical contact and the shared space, mas madalas na magkasama, no. Pero may mga small percentage naman kami that maybe that particular person hindi talaga siya nagshe-shed ng gano'ng kadaming virus, no? Talagang nagde-negative even the partner or the husband, no? So, may mga activity pa rin kami, may mga nakikita pa rin kaming mga cases na gano'n, but considered pa rin talaga lang close contact. So this one is a reproductive number, no? So I would just like to ano lang to, inform you kasi minsan naririnig natin to, 'di ba, yung are not, are not, are not. Okay? So it is the number of people one infectious person will infect if everyone that person has come in contact with, no? So the lesser the number of are not, the better, no? Kasi kunwari ang isang confirmed case nakapanghawa ng 6, no. So ganun yung reproductive number ng patient na yon, no. So mas maganda ang pag bumababa ang R naught, mas maganda ang ating cutting the transmission because yung isang confirmed case mo hindi na nakapanghawa kasi na-isolate mo na agad. Yung close contact niya hindi na nakapanghawa kasi na-identify natin siya agad, na-isolate natin, hindi na siya nakapanghawa. Ganyan siya, no? So this particular number, the reproductive number or the R naught is a very good number or tool to identify how very good our contact tracing is. No? So, for measles, no, siya yung pinakamataas na R naught, no, 15, no. While compared to COVID and flu, no, about 2 to 3, no, a person, no, can infect 2 to 3. But the problem is, ayan, no, so this particular person nagmumultiply kasi yung close contact mo magkakaroon din ng sariling close contact na may sariling close contact, so it multiplies, no? So so kaya isa sa mga reason why they requested NCR to be in ECQ now in MECQ is to really prevent this from happening, no, yung doubling effect niya. Okay. So yan. So impact, so just one, no, na prevent mo yung confirmed case na wag na lumabas, yung close contact na hindi nalalabas, and mawawala yung mga possible na pwedeng napanghawaan nila. Now, the incubation period, no, sometimes it varies. Kaya napakahaba ng incubation period niya, no? 2 to 14 days. And the problem is during the incubation period, there is a possibility na nakakapag-infect na sila. So, dapat medyo yung mga contact tracing teams natin, alam nilang hanapin when is this incubation period ng possible incubation period ng ating mga pasyente. Okay, another is the infectious period or infective stage. So this is the time during which someone infected with COVID can transmit the virus to other. No? For people with COVID-19 disease, the infectious period begins 2 days before the start of signs and symptoms, and the end of the infectious period as declared by WHO 10 days after the signs and symptoms, or for DOH 14 days after the onset of the signs and symptoms, no? So ito yung binigay, no, doon sa ating DOH circular. And or kung ang problema kasi minsan asymptomatic sila, so you cannot ano ang bibilangin, no? So sabi nila ang pagbilang natin is on the day of the result came, no? So yun yung pagbilang po natin if they are asymptomatic, no? Kasi doon mo lang kasi nalaman o na-confirm na with COVID siya, kaya doon pa lang ang pagbilang natin just to be on the safe side, no? So people who are asymptomatic can also be infectious. For these people, the infectious period is more difficult to define. No? Sabi ko nga, mas mahirap kasi you cannot count backwards kasi wala kang bibilangin na because of there is no symptoms. No? So here is the timeline, okay, of the incubation period. So sabi dun sa incubation period is from 2 to 14 days, no? But there is an average. Typically, no, what we see among our patient, on the 5th day, 5th to the 6th day, doon talaga nagkakaroon ng first symptom nila, no? Yung paglalagnat, pagsasakit ng katawan, no? So ito common to. And then latter part na lang yung pag-uubo and loss of smell and taste. Ayan. So, usually the signs and symptoms. Ayan, no? So, from the incubation period, ayan, no? So, within the incubation period, maglalabas na ng signs and symptoms, and then you count na, no? From the time that the first symptom arrived, doon na yung pagbilang natin. Yan. And madidetermine natin after 2 days before the signs and symptoms appear, infectious na rin siya. So you have to count 2 days prior. Okay? So, hello? Ayan. So you have to count 2 days prior. Okay? So, ito yung sinasabi ko sa inyo kanina na from the signs and symptoms, you have to count 10 days. Yun na yung mawawala na yung kanyang hindi na siya ganun ka-infectious. Hindi na siya infectious, or you can declare it as recovered. Okay? So, pwedeng mag-swab, pwedeng hindi based on the guidelines of the DOH. Ganyan siya, no? So, I think they recommend this because of there is a number of patient in line queuing para doon sa ating swabbing, no, para sa RT-PCR. Kaya based on the research, non-infectious naman na sila. That's why you can declare them recovered after counting that. Ganyan siya. But kung sa locality ninyo, hindi naman ganun kahaba ang pila for swabbing, kung gusto ng pasyente, pwede pa rin naman pa siyang paswab. No? But definitely, yung 2 negatives, isa sa mga hindi nire-recommend na ng DOH ito. Okay, so kanina, diniscuss na kanina yung mga definition, no, of confirmed, suspect, probable, and contacts, no. So, ito yung mga definition na hahanapin natin among those kung sino ang considered as close contact natin. Okay? So, someone who have contact with case while they were infectious, no, during their illness and 2 days before their illness began. Okay, there are 3 kinds of contact: physical and close contact and proximate. Okay, so close contact within 6 feet for 15 minutes or more. No, proximate contact naman more than 6 feet but the same room for an extended period. Okay, so usually itong mga proximate contacts na to are the office mates, no, kasi magkasama sila the whole day or 2 days, ganyan, no. So there is risk, no, yung paulit-ulit na ganon, kahit na hindi ka close contact sa kanya, there is a possibility talaga na mag-transmit yon. Nangyari to sa amin, no, if you have heard it, no, doon sa isa sa mga military camp here in San Fernando, no, na ano siya, na and two confirmed case has infected 23 individuals, 18 coming from the office kung nasaan yung isang nagtatrabaho, no. So kaya napaka ano talaga, tinitingnan talaga itong mga proximate contacts na to. Now, there's the difference between, what is the difference between isolation and quarantine? No? For isolation, these are the people who are with symptoms and they are confirmed case. No? So, restricted to home, hotel, and facility. For our local government here in San Fernando, we have our own isolation facility. That's why among confirmed suspects and talagang mga close contacts with symptoms, talagang hindi kami nagpapa-home quarantine, no. So it's a mandatory that they be isolated in our isolation facility, while quarantine naman, home quarantine will be doon sa mga close contacts na asymptomatics and doon sa mga people coming from high risk areas, no. Like for example, nagbisita or dumating yung kapatid na galing Manila, ganyan siya, no? So, yun, kina-quarantine namin sila. And now, we are opening our barangay isolation units, no? So, itong mga high-risk individuals na ito, dediretso na sila sa aming barangay isolation facility. Okay, so we have to define the infectious period, no? So you have to equip your contact tracing teams to identify this infectious period para mas in terms of isolation, mapupuno po kasi yung mga isolation facility nyo pag hindi nyo na-determine ng tama, and then masyadong ma-overload naman po ang inyong swabbing testing kung hindi nyo rin po ma-identify. Just imagine, kung 50 yung na-identify ninyong close contact, 50 din yung ipapaswab din nyo, di ba? So, nade-disenfranchise yung iba na sana is mas naunang na-swab, no? So, kailangan very strategic din tayo sa pagkikita na ito. Okay? So, you called the case on May 10, no? So, dito sa example natin, May 10, and they tell you they become ill on May 9. Okay? So, doon sa pagbilang ninyo, okay? So, May 9, so starting 7, 8, infectious na yung pasyente natin. Okay? So, mula 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, lahat ng mga naka-close contact na ito. no? Because you have called them up by 10, so ang i-contact trace nyo lang is the activity between May 10, 9, 8, and 7. So from starting May 7 to 10, lahat ng mga activity niya, lahat ng mga close contacts niya. So you have to determine if they're close contact, if they're proximate, yung physical contacts, no? So para ma-determine niyo lahat. Okay, so 9 plus 10, no? So ito na yung infectious period niya. Okay? Based on WHO classification, no? Because this is symptomatic, no? With symptoms kasi siya. Now, ito naman. Okay? So they fully recover by May 19. Now that you know their infectious period, you may help them identify their contacts. Okay, so fully recover naman na siya by 19 because 9 plus 10, 19. No? But for DOH, you have to count 14 days upon the onset of illness. No? So 9 plus 14. No? So ganun naman sa DOH. So how long should the contact stay in quarantine? Okay. So ideally, as long as they could be infectious. No? DOH says 10 days after the onset, but the DOH says it's 14 days. No? So determine mo kung symptomatic ba siya or asymptomatic. No? So 14 days and last contact may develop even days ago. No? So kaya kailangan ano natin. So the 14th day, i-discharge mo siya. Kunwari nasa isolation facility ninyo, i-discharge mo siya ng 15. Okay? Okay, how long should the contact stay in a quarantine? So call the contact. Okay, let's assume you call the contact on May 13. Okay, so based on the call, you understand that the last contact with the case was May 10. Okay, so yun yung last contact niya. And okay, so they should receive instruction to quarantine for 14 days since that last exposure. So, magkasama sila nung May 10, okay? So, bibilang ka ng 14 days. So, pagbilang is after, no? So, 10. So, you started counting sa May 11 hanggang 24. Okay? Even if you called them on the 13th. So 14 days to be safe. Okay? So organize, train, and contract tracing teams. No, sabi nga nila, it's a requirement, no, that every local government unit should have a contract tracing teams. No, so the more the merrier because mas maganda kasi mas mabilis. No, so contract tracing teams should know people in the community. Mas maganda and kaya nga isang reason why PNP is involved, including the BFP, among the multi-agency contact tracing teams because yung kanilang connections, no, in terms of identifying people where they are, no. But for us, ang main lead po talaga here in San Fernando is the BHERTS, no, kasi mas kilala ng mga barangay health workers namin, kagawad, kapitan, yung kanilang mga locality, no, except na lang po talaga sa mga subdivisions or mga gated housing, no, na medyo nahihirapan kami doon. But now, we have an executive order for that na minamandate namin yung mga homeowners association to take the lead, no, na we have different teams there para mas mabilis yung pagko-contact tracing natin, no? So I already reiterated a while ago that train and train contact tracers, no? So contact tracing is a skill, no? So hindi po siya na-train niyo siya today, automatic magaling na po sila, no? So paulit-ulit, no? Kaya siguro ang mga DOH and WHO pabalik-balik din sila sa amin, no? no. One thing I also see na even if you are confident with their skill, kailangan every now and then you review them, no. Just like what we do every now and then, I ask one of our doctors who are the supervisors of this contact tracing, no. So sabi ko, you review them. Sabi ko, lalong-lalo na pag may nakikita ko na mga konting mga lapses or konting mga uh, time na hindi agad nare-report, no. Kasi for us here in San Fernando, I've targeted 48 hours na contact tracing target nila, no. So within the turnaround time of 48 hours, dapat complete na yung report nila, nakita na nila kung sino yung mga close contacts, lahat ng mga possible close contact with symptoms nasa isolation facility na, and scheduled for swabbing na rin sila. So yun yung binigay kong turnaround time para sa kanila. And it works for us because bago pa lumabas yung mga result nila, nasa isolation na. And true enough, they are a confirmed case, kaya mas nalilesen namin yung kanilang transmissibility among other people. So, this is John Hopkins steps to investigate cases and trace their contacts, no. So it's sabi ko nga, the knowledge given by DOH, by WHO, and if you think that you can have other materials, do you think that it's much easier to implement or much easier to understand, no, dun sa mga contact tracing teams ninyo, or if you have other things na sa palagay niyo mas makakatulong sa locality ninyo, mas gawin ninyo yon. Kasi if the end result naman is just the same of that of the contact tracing, wala naman pong nilalabag na any law or any policy of the DOH, okay lang naman na igawin yon kasi kayo po ang mas nakakaalam ng localities ninyo, no. So this is the 6 steps, no. Introduce, inquire, identify contacts, isolate, initiate contact tracing, and implement regular check-ins, no. So para sa amin kasi, we have this kahon ng buhay wherein we have set up a different strategies, kaya mas mabilis para sa amin. We have our isolation facility, we have partners in testing, no. We have contact tracing teams, no. So we have telemedicine right now, no. So parang it's only organizing all these efforts, these strategies para mas fluid yung pag-i-implement ng mga strategies niyo, no. So siyempre, you introduce yourself, no. Introduce yourself to the case and get their basic information, no. So one way of getting to know them, okay. So step 1 to 4, calling the case. So you introduce, you inquire about the infectious period, identify contact, and instruct how to isolate, no. So yung pinagkwentuhan po natin kanina na time period, yung mga infectious period, incubation period, no. So makakatulong po dito, no, pag pinaplat ninyo yung possibility na kailan kaya siya maaaring nag-infect, and sino yung mga nakasama dito, no. So dun po sa step 3 yon, identifying contacts, no. And also you have to instruct them, no, how to isolate, no. So kung babalikan po natin, no, so introduce yourself, you have to figure out the case is likely infectious period, and you ask the close contacts, okay. For us here, we have our own isolation facility. So for those confirmed, automatic po, no, nasa isolation facility sila. And kung paano naman po pabaligtad naman, na-identify siya as a close contact, no. So and with symptoms siya, automatic suspect, you have to isolate them also, no? So you have to do all these steps, 6 steps again, lalong-lalo na dun sa mga close contact natin. Kasi you have to explain to them kung bakit sila kailangan ma-isolate, no? Ganyan siya, no? So also, yung contact tracing nga for those na mga confirmed cases po natin, no? So the cycle goes on, lalong-lalo na po pag hindi talaga natin nakikita pa lahat yung mga naging close contact niya. So for example, yung si patient X, no, a confirmed case, nakasama niya sa trabaho si patient Y, then nag-positive din po si patient Y. Si patient Y noon magiging index patient na rin natin kasi magkakaroon na siya ng sarili niya pong close contact. Ganyan siya, no? So it's very prudent para sa atin na close contact pa lang siya and you have determined that there is high probability na mahahawa siya, you have to initiate contact tracing na rin, no, para doon sa next line natin. Kasi baka ang mangyayari, pag hinintay mo pa yung result, hindi ka pa nag-contact trace, nasayang yung pagpunta mo doon kasi missed opportunity na yon na sana nasabihan mo na yung mga close contact ng close contact na mag-home quarantine muna kasi while waiting for the result of this close contact, no? So nangyari kasi sa amin 'yan no. Yung mga close contact, nalaman nila na close contact sila, but this one unreported sa amin, no? So nalaman nila na yung friend nila ay confirmed case. So yung nagpa-test sila, nag-walk-in sila sa laboratory, and then afterwards and doon nag-positive, no? So mas maganda kung makita na natin sana sila agad, no? Hindi na nagkakaroon ng missed opportunity, no? So ito din kasi nagiging problema right now, no? A lot of walk-ins are coming, are doing the self-testing, no? Pupunta lang sila sa laboratory and then hindi na-explain ng tama, no? So kailangan yung information dissemination din natin on the localities, on the local government unit, mas palakasin pa natin. Okay? So, implement regular check-ins, no? So, whether in their isolation facility, ito mas mas structured kasi may mga specific hours, no, silang monitor. But doon sa barangay isolation units and doon sa mga household natin, so we have to really identify, no, kung sino ang magmo-monitor, sino ang may responsibility na i-monitor sila at bantayan, no? So, lalo na po yung mga close contacts natin na asymptomatic na nasa bahay lang, meron po dapat responsible person na nagmo-monitor po sa kanila. And for the health workers, hindi na po talaga namin kakayanan, no, na kaya kailangan natin ng help ng other attached agencies. Yan. So, for step 5, no, inform about the exposure as about symptoms, instruct on quarantine, and implement regular check-ins with the case and contacts. Ayan. So, doon sa introduction, ito po kasi ginagawa namin among our contact tracing teams. So, every now and then, we review them. No? So, tinuturuan po namin sila ng, hi, this is Jang from City Health Office. Is this Katrina? So we do phone checks, no? So we provided all our barangay health stations with cellular phones, cellular line, no, para they could call para to check in and to verify kung nandun talaga siya sa bahay na yon, and then pupuntahan na sila later on. Okay? So, yung mga introductions natin. Okay, so during the call, pause and assess the need for medical care. Yan. So, you have to ask, no? You have to ask, and then you have to, if immediately kailangan mapuntahan na, no? For us kasi, we call them, and then usually ang ginagawa namin, since they are a confirmed case, we call them, and Hello, ayan. So, what we do is we call them and we ask if they're at home. And then, kung ano, team po kasi silang pupunta doon, no, kasama ng mga attached agencies natin. If we see that medyo highly populated yung lugar, na magkakaroon ng confusion or nagkakaroon ng panic, so what we do is we ask the person na directly go to the isolation facility para doon na lang po namin gawan ng aming mga contact tracing uh, sheets. Okay, so we have to inquire about the infectious period. So, nasabi ko na to kanina, diretso na po tayo doon sa calculations natin, no? Ito po, no? So we use this, no? We have a case timeline, no? Para po hindi po yung mga contact tracing teams namin, hindi sila nakaku-confuse, no? Sasabihin lang nila, tatanong nila when is the first signs and symptoms or talagang detailed na tinatanong sa kanila kailan, okay, nagkasipon, no, kahit ano lang nangati yung lalamunan, no, so yung mga ganon. So para mas guided, no, with this case timeline. Okay. So, sabi ko nga kanina, based on the DOH memorandum, meron po tayong definition nun, no? Kung sino yung mga close contacts natin. And we follow that. Okay? So, may mga helpful questions po tayo na may guide, no? Na pinapakita din kami sa mga contact tracers namin para meron po silang, hindi sila, though sa orientation, alam, binibigay naman na ito, pero may guide pa rin dapat, no, dun sa mga pagtatanong. Ayan. So, ito po yung aming investigation report, no, para mas detailed. Then, hindi na rin po pabalik-balik, no, kasi we have previous experience during the March period, no, na nagsisimula po ito, pabalik-balik yung mga pasyente kasi pag magtatanong ang doktor na i-determine itong case timeline, pabalik-balik pong pinupuntahan ng pasyente, no. So, sabi namin, close contact na rin siya later on, no? So, kaya po nakapag-devise po kami ng ganito. Aside from the CIF. So, for components of isolation instructions, we have to explain in simple terms, ask questions to check that they understand completely and help them plan, identify challenges that may stop them from following your isolation instructions, offer resources to improve their chances of following instructions, isolation instructions, no? So, sabi nga po namin, if they are a confirmed case in our local government unit, they have two options, no? One is dun sa isolation facility namin, and next, if ayaw po nila sa isolation facility namin kasi hindi po siya aircon, no? But free po lahat, accommodation and food, pati laba, if they still don't want that, kasi gusto nila yung aircon, centralized aircon, 5-star yung itsura, ganyan, no? So, we have one hotel na kinontract wherein pwede po silang mag-check-in doon, but sa kanilang bayad na yon, no? At their own expense, and health workers will also be monitoring them. Ang coordination namin doon sa hotel is ang pag-check-in, kami na mag-check-in, pero pag-check-out, sila na, ang pasyente itself, kasi this one, may negatives, may swabbing talaga sila, kasi meron naman po silang capability, and hindi na rin po infectious. So, sila pa rin po magbabayad. The disinfection and everything, sa City Health Office pa rin po ang disinfection, kasi yung fear among the people, no, lalo na po yung mga staff ng mga hotels na to, very fearful sila. So, yung mga tao na po ng City Health Office ang in charge for the disinfection. So, check the understanding and help make a plan, no, with them, no? Kasi yung iba po kasi akala nila every patient na confirm kailangan nasa hospital, no? So, let us help decongest the hospital also, no? Lalong-lalo na po kung mga mild symptoms lang po talaga sila, no? So, for San Fernando, we have 107 bed capacity isolation facility, and plus the hotel establishments of mga mga 30. Mangilan-ngilan lang naman po ang ayaw dun sa isolation facility namin na libre. Okay, so description of 4 components of isolation, instructions, identity, challenges. No? So, what concerns do you have about the responsibilities and mental health? No? So, may mga nakita po kasi kami among our isolation facility, medyo worry sila, medyo anxious, and yung iba talaga as in sobrang devastated dun sa result. No? So, kaya plus the fact na ma-isolate sila for 14 days. No? So, meron po kaming mga social workers na do telecounseling, no, where tinatawagan sila, nag-uusap sila para mas yung kanilang mental health naman po mas maging kampante sila during the isolation. So wrapping up with the case, so answer their questions, make a plan to follow, and of course the pleasantries and extending the services that we give para mas accommodating kumbaga yung ating mga health workers and that of our BHERTs. So contact tracing, so check if they have symptoms, provide instructions for quarantine, answer the questions, and make a plan to follow up. No? So among the close contacts din. Kasi sometimes, anong gagawin ko kasi nakasama ko to, no? So, paano po, pa-trench out niyo po kung ano yung mga questions po nila para mas, ano po sila, mas kampante sila. So these are the frequently asked questions from contacts. What happens if I get sick? How do I get tested? Do I need a mask? Can you give me a letter for my job and landlord? Ganyan, no? So, us, no, sa mga health workers, sa mga BHERTs po natin, no, lahat, no, tinitingnan namin what mga questions po nila o yung mga nagka-come up na issues and nagto-troubleshoot na rin po kami kung paano natin sila matulungan. It's not, hindi po automatic na nanggagaling sa offices namin yung mga queries nila, but tinutulungan na rin po namin para ilapit sa mga iba't ibang mga departments. So regular check-ins, no? So most especially those naman po na nasa home quarantine. So we always do that, no? So you may regularly check with cases and contacts to determine when they can end their isolations or quarantines, no? So do they still have symptoms? Have they have a new contacts? May pumunta po ba? May nakapuslit po ba, no? Offer support for continued isolation kung may contacts, or just in case they have symptoms dun sa mga asymptomatic ninyo na nasa home quarantine, nag-symptom, we provide, for the city, we provide swabbing and then put them in the isolation facility. So, dapat, doon pa lang sa step 1, na-introduce na po natin lahat itong mga possibilities para pagdating po ninyo doon sa mga possibilities na to, hindi na sila masyadong nabibigla. Okay, so yun lang po, no? So, this one is a practice investigation scenario. Like I've said, we use this in our contact tracing trainings, no? So, I think it's this one is a different lecture and specifically dun sa mga contact tracing teams na po ito, no, na ibibigay namin. So if you have questions, maraming salamat po.
Thank you very much, Dr. Ranely, for that presentation. For questions po, please send them in our chat function and we will raise them later during the open forum. To move on to the last presentation to be presented by the Department of Health, we have the Region 3 RESU Head, Ma'am Rosana Rosel, and WHO Technical Officer, Dr. Ralph Nico Salibio.
Hello po, good afternoon.
Good afternoon, ma'am.
Good afternoon po sa lahat. Good afternoon, Director Julie. Good afternoon, Dr. Ren, our good friend from the city of San Fernando. for showcasing po their best practice in terms of the conduct of close contact tracing.
Afternoon, Rose.
Yes, I have with me Dr. Nico Silibio from the WHO. Salita na po. Hello lang po.
Good afternoon, everyone.
Good afternoon, Doctor.
Okay, so I will now be sharing my PowerPoint presentation for this afternoon's orientation on the close contact tracing. Klaro na po ba, ma'am?
Yes po.
So, okay.
Yan yung nakikita nila.
Duplicate slideshow. So, breaking the chains of transmission involves different activities, and these are first and foremost is the case investigation. That this is very important, so as we will be able to identify cases and the relevant exposures. Contact tracing, trace the close contacts of the cases. Analyze exposures to identify sources of infection and patterns and pathways of transmission. So there are different stages of transmission. First is that an area has no cases, no signals of undetected cases. So the relevant actions would be screening and quarantine of people coming into the area. So isa pong example dito ay yung province of Aurora. Sa ngayon po, wala pa po silang case ng COVID. But they do active case finding. Lahat po ng papasok doon sa kanilang probinsya, they required individuals coming to the province to be screened and to be quarantined before they can enter into the province of Aurora. And limited pa lang pong interventions that can be implemented in this area since there is still no detected cases. Second stage would be the stage 1 of transmission, wherein meron na po tayong imported case. One example of this is an area with no cases. Suddenly may dumating po na OFW or locally stranded individuals na positive. So most cases linked to importations and no signals of local transmission. So what we should be doing, ensure contact tracing, increase border measures, increase testing, isolation of cases, and quarantine of contacts. This is to ensure that the chain of transmission will be stopped. No, hindi na po dadami yung case. As mentioned earlier by our presenter, Dr. Ren, yung pong tinatawag nating R0, this particular imported case should not be spreading the disease within our area of jurisdiction. The second stage of transmission would be the localized community transmission. Most cases are locally transmitted and no signals of widespread transmission. So what we should be doing here, we should be intensifying our contact tracing, suppression of clusters and hotspots. So for instance, we have 2 cases in a barangay or a sitio that we could not link to an imported case. We now have a localized transmission, and thereby we really need to suppress the transmission of COVID in our area. That's why i-intensify po dapat ang contact tracing. Yun po yung importante, that we should be identifying individuals who have had exposures to this confirmed case, at para po natin sila ma-quarantine or ma-isolate, thereby stopping the chain of transmission. And we do targeted testing strategies. So we don't do indiscriminate testing. So very important po is the judicious use of our limited resources. So just identify individuals who really have an exposure to this confirmed case, closure of businesses and schools, and movement control orders. No, this is very effective also of containing the spread of disease in that particular area where it is starting to spread pa lang. Now we have the third stage, which is the large-scale community transmission, clusters difficult to define, healthcare system beyond capacity. So interventions focus on protecting healthcare capacity, testing focused on high-risk persons. So are we now in this stage, sa palagay niyo po, that we really need to protect our healthcare system capacity? As mentioned earlier, those confirmed cases not needing admission should be confined in an isolation area that is being managed by the locality, no? To decongest our secondary level, tertiary level hospital. So kung kaya naman po siyang i-manage at a lower level of healthcare facility, then do so. Instead of bringing or admitting cases doon sa mga higher level hospitals na pag magkaroon na po talaga ng mga severe and critical cases, we could no longer admit them because we allow our not admissible confirmed cases na nandoon po sa ating hospitals. That's why I really commend the City of San Fernando because they have a community isolation unit where they can actually manage these asymptomatic individuals or confirmed cases in their locality. So the case investigation of cases to identify close contacts is the prelude for any close contact tracing activities, no? So of course, before we can do a contact tracing, we should have already the details of a suspect probable of confirmed cases po na hawak na po natin. This means that we should have a completely filled out case investigation form in our hands. So sa LGU po naman ito lahat mag-emanate. So if for instance, meron po tayong confirmed case na hindi po na-investigate or nagawa ng case investigation form ng isang LGU, then they should have a profile, the complete demographic information of this particular confirmed case. And then we need to identify minimum data from the case investigation form. It is necessary, no, for the local government units through our local epidemiology and surveillance unit to do a case investigation, completing the profile of a particular case. Kumusta po siya, may symptoms po ba siya ngayon, and then after which, we should list down all the close contacts and contact information of those identified close contacts of the confirmed case. Though initially, suspect pa lang po siya, nasa case investigation po ito, that this particular case should already have the list of close contacts. Submit to the contact tracing team, contact tracing and monitoring team the completed case profile and close contact line list. So, si Leso po, our local epidemiology and surveillance unit who is in charge of investigating all cases of COVID should have the complete information of the confirmed case and then endorsing this to our close contact tracing team who will in turn do the following activities, no? So meron na po kayong complete profile ni case and with it the list of contact close contacts. Then the next activity would be to look into whether the case ay nasa health facility po ba siya, or nasaan po ba si case ngayon. Kaya kasama po kanina sa lecture ni Sir Robin that one of the indicator is for the contact tracing team to identify or to trace nasaan po ngayon si confirmed case. Na-trace po ba natin ito and na-assess po ba natin si confirmed case. Kung nandun po siya, yes, commence contact tracing by designated team, identify clusters and suspect sources of infection. Kung wala naman po siya, list of secondary cases at home requiring facility isolation and then refer the case to an appropriate isolation facility after clinical assessment and management, and then commence a contact tracing by designated team. So importante po na nalulocate po natin ang mga confirmed cases natin because ideally confirmed cases should be confined in an isolation facility, no? We do discourage home quarantine or home isolation of our confirmed cases. So kung lahat na ito po ay nagawa, next step would be to assess, di ba? We are going to assess our close contacts and check if those close contacts that were assessed by our monitoring team fit the following case definition of a suspect case. So, dito po, paano natin mapapabilang ang isang close contact na suspect case po siya? Kung siya po ay mayroong influenza-like illness na may kasamang lagnat at tubo o pananakit ng lalamunan at alinman sa mga sumusunod. Naglakbay o nanirahan sa isang lugar. So si close contact po ay isa na po siya agad na suspect kasi isa po sa criteria para po siya ay ma-classify na isang suspect ay dapat po nagkaroon siya ng exposure sa isang confirmed or probable case sa loob ng 14 na araw bago nagsimula ang mga sintomas. So si suspect case ay or si close contact, pag meron na po siyang sintomas ng ILI, siya po agad ay nakakategorize or nakaklasify na isang suspect case. O kung si close contact ay may lagnat or may ubo or hirap sa paghinga at kabilang siya sa tinatawag na vulnerable individuals or vulnerable groups. Sila po yung senior citizen, edad 60 taong gulang at pataas at mayroon pang iba pang sakit or tinatawag po natin, laging naririnig na comorbidities. Isang individual na mayroong maselan na pagbubuntis at yun pong ating mga health workers. Ang pangatlo pong mapapabilang sa klasipikasyong suspect ay yung nagkaroon ng biglaang karamdaman sa baga na may malubhang simptomas na hindi matukoy o ang kadahilanan at kailangan pong ma-ospital. No? So yun po yung tatlong kategorya upang po mapabilang sa klasipikasyong suspect case. Sino naman po si probable case? Si probable case po ay isang suspect case na nung pong siya ay na-test ng RT-PCR, ang resulta po ay inconclusive. No? Hindi tiyak ang resulta ng testing. Ang nakalagay po doon sa laboratory results niya po ay inconclusive. No? And the second one is ginawa yung test sa hindi opisyal na laboratorio na gumagawa ng RT-PCR test. So hindi po siya accredited ng Department of Health, pero positive po yung resulta niya, mapapabilang lamang po siya sa kategorya or klasifikasyon ng probable. At sino naman po ang mapapabilang sa klasipikasyong confirm? Sila po itong mga suspect cases na nag-positive nga po sa RT-PCR test sa isang accredited na laboratory ng Department of Health. So lahat po ng ito, lalong-lalo na po ang ating suspect case, ay kailangan pong magawan siya ng case investigation form na tinatawag. Napaka-importante po ng case investigation form. Andito po nakalagay ang mga impormasyon na kinakailangan po ng ating mga contact tracing team pag siya po ay nagkaroon na po ng positibong resulta. So dito po sa ating case investigation form, na suspect pa lang po siya, meron na po siyang listahan, no, ng mga close contacts niya. So during investigation po ng ating surveillance officer, tinatanong na po si suspect case kung sino-sino po ang kanyang nakasalamuha 14 days prior siya nagkaroon ng simptomas. So ililist down na po ito. Isa po ito sa gagamitin ng ating contact tracing team na mabigyan po sila ng kaukulang assessment and payo kung ano dapat ang gagawin sa kanila. Kasi positive na nga po si suspect case. So ano po ba ang contact tracing? Bakit po natin ito ginagawa? So, ang contact tracing po, ito po yung proseso ng pag-identify. Pag po natin na-identify sino na po si close contact, kailangan po natin siyang i-assess kung siya ba ay may mga sintomas, no, na pong may kaakibat or maaari pong may kinalaman sa sakit na COVID-19. And dapat po silang ma-manage ng maigi, no? Itong mga individual na na-expose po para po mapigilan ang pagdami pa ng kaso sa ating localities. So, a contact tracing activity is very important po, no? It's very essential public health tool for controlling infectious disease outbreaks because it will break the chains of transmission of an infectious disease when systematically applied. So, importante po yun na yung sinasabi kaninang Arnott ay hindi po ito mangyari if we are doing our contact tracing efficiently and effectively. Specific to COVID-19, this requires identifying persons who may have been exposed to COVID-19 virus. And once we identify them, we need to quarantine these close contacts. And if they have signs and symptoms, they need to be isolated and followed up for the 14 days from the last point of exposure. So dito po mangyayari ang monitoring of our close contacts by our monitoring team. So these are the different goals of contact tracing. Again, we wanted to interrupt the ongoing transmission and reduce spread of the infection. And then we wanted to establish the link epidemiologically or track the sources of infection and contain further spread of COVID-19 in the locality, and to identify and amplifying events and situations so that measures for suppression can be initiated, to alert contacts to the possibility of infection and ensure rapid quarantine or isolation and timely referral for management and care. Another goal of contact tracing is to provide necessary health information and counseling. No? Na-address po natin ang stigma, ang fear ng isang close contact. Dito po lahat yun mangyayari. And to learn about the epidemiology of a disease in a particular population. So napakahalaga po talaga na hakbangin ang paggagawa ng contact tracing in our respective localities. So, paano po ba dinidefine? Sino po ba si close contact? Ayon po sa Department of Health issuances. So, a close contact po is a person who may have come in contact with the COVID-19 case 2 days prior to the onset of illness of the case. So, kung wala naman pong simptomas ang ating close contact or ang ating case, marapat po na gamitin natin as a reference yung 2 days, yung araw kung kailan siya nakolektahan ng specimen. Until the time that said cases test negative on laboratory confirmation or other laboratory test, approved laboratory testing centers. So yun po si close contact. So paano ka po ba masabi na ikaw ay isang close contact? Unang-una po, you have had a face-to-face contact with a probable or confirmed case within 1 meter and for more than 15 minutes to a confirmed case. You provided or you had a physical contact with a probable or confirmed case, no? So kalimitan dito yung mag-asawa, mga kasama sa bahay, nagbeso-beso or even nag-shake hands. Third is direct care for a patient with probable or confirmed COVID-19 disease without using PPE. Commonly po ang ating mga health workers and other situations as indicated by the local risk assessment. So there are different settings no na pwede pong mangyari ang makapag tinatawag po nating mga areas, amplifying areas where the spread of COVID-19 may happen. So household and community social contacts. So specific contact po sa area na ito would be face-to-face contact with a case within 1 meter and for more than 15 minutes. Direct physical contact with a COVID-19 patient, providing care for a COVID-19 patient in the home without proper PPE. So that's why dinidiscourage as much as possible na si confirmed COVID ay nasa bahay po. No? Anyone living in the household are close contacts kung nandoon po si COVID-19 confirmed case. So how can we identify contacts is we interview them with the COVID-19 patient. Pwede po itong gawin through telephone or can also be done in person. Provided that yung pong ating contact tracing team should be wearing the proper PPE. Closed settings such as long-term living facilities and other high-risk congregations, closed settings, prisons, shelters, hostels. So kalimitan po, mabilis pong mag-spread ang COVID-19 considering po na this is in a closed setting, in closed space or environment. So we can identify contacts through these areas na rin, no? Kasi pag nasa isa po kayong close setting, mataas po ang chance na na-expose po talaga yung nandoon because most often than not, sabay-sabay pong kakain, and when we eat our meals, we of course remove our mask. So that's another way of identifying close contacts. Healthcare settings naman po. Healthcare workers, any staff in direct contact with the COVID-19 patient where strict adherence to PPE has failed. So pag sinabi pong na-expose po kayo, ang isang health worker, that only means that this individual is not wearing the appropriate PPE. Contacts exposed during hospitalization, any patient hospitalized in the same room or sharing the same bathroom as a COVID-19 patient, visitors to the patient or other patient in the same room, other situation as dictated by the risk assessment. Contacts exposed during outpatients visits, anyone in the waiting room or equivalent closed environment at the same time as a COVID-19 should be listed down as a contact din, no? Or anyone within 1 meter of the COVID-19 patient in any part of the hospital for more than 15 minutes. While identifying naman close contacts in public or shared transportation, anyone within 1 meter of the COVID-19 patient for more than 15 minutes, direct physical contact with a COVID-19 patient, or anyone sitting within 2 rows of a COVID-19 patient for 15 minutes, and any staff in direct contact with the case. So, how are we going to identify? So contact identification is generally possible only when there is allocated seating. So our experience po here was during the returning OFs, no? Pagdating dyan sa Clark, sinusundo po sila ng bus and then hinahatid po sila sa kanilang mga accommodations. So it's good thing kasi doon naman meron pong seating seat number na pinoprovide sa amin ang um, what they call this, ang ating mga partner agencies. Like sa airline and transport authorities should be contacted to obtain details of passengers and flight manifest. So one way of identifying contacts is getting the flight manifest of a particular airplane kung may nag-positive po na passenger doon. For public or shared transport where passenger list or allocated seating is not available, a media release may be required to request passengers to self-identify. Media release may specify the date, time, pick-up location, and arrival destination and stops along the way. Requesting people self-identify as a potential contact. So that's another way of informing our close contacts, no, to seek and visit our health centers, for instance, or contact our contact tracing teams for monitoring. Ayaw. So, who are the members po of our close contact tracing team? So, ang team leader po would be our city or municipal health officer. And co-team lead po is the city or municipal Philippine National Police. City or municipal members would be the city, municipal, Philippine National Police, physicians, nurses, midwives, or sanitary inspectors from the city or municipal health office, local population officers, workers, and volunteers from the city or municipal population office, our partners from the Bureau of Fire Protection, City or Municipal Disaster Risk Reduction and Management Office, the BHERTS, and other staff or individuals who shall be designated deputized by the team leaders. So this is a simplified way of doing a contact tracing. First, step one is to identify and list close contacts, identify avenues or settings. This could be done by our local epidemiology and surveillance unit. Inform and profile close contacts and announce avenues, settings. Step three, we should manage and monitor close contacts and manage amplifying events. So in doing the contact tracing, we should identify areas or venues where the exposure had happened, no? So kinakategorize po natin siya into those who were exposed in the workplace, in the household, in public places such as markets, pawn shops, etc., or in the healthcare facilities like the hospitals, health centers. So we interview and call our suspects and gather information dun sa history of exposure and asking them who are their close contacts or individuals who have had interact with during those times na sila po ay nagkaroon ng signs and symptoms and 2 days before that. So this is algorithm showing you the identification, assessment, and management of close contact. So unang-una po, pinapakita po namin dito na suspect pa lang si COVID case, dapat meron na po agad tayong listahan ng close contacts, no, doon sa ating suspect case. And for those identified close contacts na asymptomatic, so ito po yung ginagawa. Pag asymptomatic po si close contact at hindi naman po siya health worker, he or she should undergo a 14 days strict home quarantine and monitor for development of signs or symptoms until end of quarantine. So, asymptomatic individuals should not be tested or should not be swabbed. Next po, if A close contact who is asymptomatic is a health worker with low risk exposure may still report to work but shall undergo self-reporting for the next 14 days and no lab confirmation testing is being required. But if an asymptomatic health worker has had high risk exposure to a confirmed case, dapat mag-undergo po siya ng 14-day quarantine and monitor for development of signs and symptoms and should be swab or should be tested with RT-PCR. No? So, yun po yung algorithm for management of our close contacts. How about for those individuals naman na close contacts who were symptomatic? So, if that symptomatic close contact, i-assess po niyan ng ating mga surveillance officers or ang ating mga monitoring team kung yung simptomas po ba niya ay nag-fit dun sa case definition ng suspect case as mentioned earlier, no? Yun pong may lagnat, masakit ang kanyang lalamunan or inuubo po siya. So that would fit a suspect case. So i-reclassify po natin si close contact. This time siya po ay isang suspect case that needs to be isolated in a health facility and should undergo laboratory confirmatory testing. While those who did not fit the case definition must undergo 14 days strict home quarantine and monitor for signs and symptoms until end of quarantine. For now, no need for swab testing kasi hindi po siya fit sa case definition ng suspect case. This is to judiciously use our limited resources. Okay? So, yun po ang ating contact tracing process. So here naman po, sa suspect, probable, confirmed case, once we identify contacts, titingnan po natin siya, close contact ba itong nabanggit or nagsabi na siya daw ay close contact. So we categorize them, assess them. If close contact po siya, ina-assess po siya ng contact tracing team and monitoring team for presence of signs and symptoms. And then we identify whether he or she is a health worker. And pag hindi naman po siya close contact, we should be providing information on infection prevention and control, and then instruct po to monitor signs and symptoms. No, for those close contacts that were identified, the PNP with local health authorities using the list of close contacts will identify, locate, and further identify and profile other close contacts and classifies as follows. Those first po is those only needing home-based quarantine and for daily monitoring. And home-based quarantine plus those needing to be tested. And those close contacts that need to be isolated in a health facility and must be tested din po. So yun po yung 3 categories for assessing our close contacts, no, at the LGU level. So this is our close contact line list form. I hope everyone gets to see this form na po. Kasi nakalagay po, this form should be in the hands of our contact tracing team. Sila po ang maglulocate or hahanap po ng mga close contacts identified by our confirmed case based on the interview conducted by our contact tracing team doon po sa ating confirmed case or basing on the case investigation form that was provided to us by our epidemiology and surveillance unit officer. So this is the close contact profile form. This one po is being implemented by the Regional Epidemiology and Surveillance Unit and supposed to be filled out by our contact tracing team on the ground. Nakalagay po dito demographic profile ng close contacts. Napaka-importante po nito because this way we can identify how many of the close contacts are vulnerable groups, and ano po ba ang naging nature of exposure niya doon sa ating confirmed case. This way also we can link a particular confirmed case na nahawa lang pala siya, no, sa isang close contacts, because this form will also generate information that this close contact naging symptomatic na pala siya 14 days prior siya nagkaroon ng exposure doon sa ating confirmed case. So that's why this form is very important, and most often than not, hindi po ginagamit. But we are now really encouraging our close contact tracing team to fill out this form, and this form actually has a Google form version, no? Ginawan po ito ng Google form, and this the link po were given to our PESU po, no? Our respective provincial epidemiology and surveillance unit, which you can actually ask from them the link so that you can fill out this form once you are interviewing a close contact. Kasi maganda po ito, we can immediately generate, no, much needed information just to have a view or a picture of ilan po ba yung mga close contacts natin. Usually, saan po ba sila na-expose? Ano po ba yung venue for hindi, ay, excuse me po, no? Hindi. Pahintayin ako. Wait lang. Yun po ang ating importance po ng Google form. And I hope that you really asked, no, from our contact tracing, from our respective PESU and MESU, the Google form version of this close contact profile form. This is our close contact monitoring log form. Isn't it that our monitoring team are required to monitor close contacts on a daily basis? So you have there the confirmed case ID and the close contact name. Importante po yung date of last exposure ni close contact sa confirmed case kasi dito po tayo magbe-base ng ating 14-day quarantine period. Remember that the last date of exposure will be our day 0, and the following day will be the day 1 of the 14-day quarantine or isolation period. Okay po, and it is recommended that as BHERTS or as monitoring teams, we should monitor our close contacts twice daily, no? So ito po yung form na ginagamit just so we can really monitor the progress of our close contacts in terms of the signs and symptoms. Kasi this is one way of knowing kung nag-improve ba or wala po ba talagang simptomas si close contact, no? So who are our close contacts? So those individuals who cared for, lived, worked, traveled, and transacted with a COVID-19 case during this time period. So ano po bang period yan? So this is 2 days before the onset of signs and symptoms. And kung naman po siya ay asymptomatic, dapat po on the day that the confirmed case was a swab. So yun po lagi ang reference natin. So halimbawa po, nagkaroon po siya ng simptomas ng August 1, those who were exposed to the case, the confirmed case, July 30 and 31, sila po yung kasama po dun sa listahan dapat ng close contacts, no? And onwards, no? Kung sino pa man po yung na-expose sa kanya from that time onwards, no? So from July 2030 up to the time na nakakasalamuha pa po si confirmed case. And until such time na the case is categorized as recovered, until na-categorize po si COVID case na recovered. So, kailan po masabi na recovered na po si COVID confirmed case? Have clinically recovered and are no longer symptomatic for at least 3 days and have completed at least 14 days of the isolation. So, hanggat hindi po na-satisfy yung criteria na yon, all those individuals na na-expose po sa kanya with those criteria that were mentioned earlier are considered as close contacts. So dito po may iwasan ang pag-identify ng sandamakmak ng close contact ng isang confirmed case, no? And as contact tracing teams, we should also be providing information to those individuals na nagkaroon po ng anxiety, natakot kasi na-expose po siya. Bakit po siya na-expose? Kasi nadaanan niya pala ito sa labi, no? Yung mga ganun pong pangyayari. So, in order to allay the fears, isa po sa mga role ng ating contact tracing is to provide this very important information na sino lang po ba ang na-considered na close contact ni case. So, importante po na malaman po natin yung mga areas na ito. These 3 important thing, no? The focus approach. 14 days prior to the onset of illness, 2 days before, and the day itself, and 14 days from onward, no? 14 days prior. So, saan po ba nagpunta si confirmed case? Because this is an important way of determining the source of infection, no? Doon sa ating confirmed case. Kaya talaga pong thorough interview or investigation of the confirmed case is very important for us to determine the source of infection. Saan po ba talaga siya nagpunta? Nag-attend po ba siya ng party? Or sino po ba ang nakasalamuha ni confirmed case? And then, we should also take note of those individuals na na-expose po kay confirmed case 2 days before the onset of illness, no? Importante rin po ito because these individuals again need to be monitored, and yung close contacts po kasi na ito, napaka-vital po nila in terms of knowing baka naman po after all, si confirmed case ay nahawa pala doon sa close contacts na na-identify. Kasi upon checking ng ating contact tracing team, si case pala ay naging close contact ng isang previously reported confirmed case. So that way, we will know nahawa lang pala si confirmed case ng previously reported confirmed case. Okay? So, close contacts monitoring log sheet is very important for treatment and outcome. So strict monitoring of quarantine and health status of our close contact. So these are very important steps, no, in the contact tracing process. So 14 days prior to that, saang avenue, saang setting, we can determine the source of infection. 2 days before or on the day itself, sino po yung naging nakasalamuhan niya. And then monitoring identified close contacts onwards. So sa 14 days po, addressing the sources of infection, link the case with settings, events, and analyze the settings and events where the cases could have gotten the infection. So action would be identifying hotspots and avenues in order to mitigate the source of infection. While 2 days before and 14 days still unresolved when transmission could have happened, we wanted to break the chain of transmission, no? Link the contacts, those who were exposed to the case, and then analyze the settings and events where the susceptible could have been exposed. So the actions that we should be taking into is to ensure that contacts are properly managed, informed, quarantined, isolated, and monitored. Informing close contacts, the contact tracing team should develop a list of persons who had been in contact with the COVID-19 patient. Each close contact should first be contacted by phone or in person to determine whether they meet the contact definition and thus require monitoring. Each individual confirmed as a close contact should be provided with information on first, the process and the rationale for contact tracing, and information on quarantine, where they will be quarantined and how they will be cared for. So all of these were mentioned earlier by Dr. Renily. Part po anong proseso nila ito and what symptoms to look out for during the monitoring period. This include any symptoms, especially fever, or at least one of the following: sore throat, cough, runny nose, or nasal congestion, shortness of breath, or difficulty of breathing, muscle pain, loss of smell or taste, or diarrhea. And next information that we should be providing as contact tracing team would be what they should do if they become unwell. And kasama po doon, sino ang i-inform nila, how to self-isolate, and what precautions to take, and what referral mechanisms are in place for testing and treatment. Another thing that we should be providing to our close contacts would be data protection, how their personal information will be used, processed, and stored. So para po maliwanag at hindi po tayo inaaway ng ating mga kino-contact trace kasi more often than not, kaya po meron pong denial because of this important information na dapat po na-inform po ang ating mga close contacts. Any other specific query or concern raised by the close contact, information should ideally be provided over the phone or in person, although alternative approaches such as emails could be considered when direct contact cannot be made. No? So, yun po ang mga important or salient points that we should be providing our close contacts with. Managing and monitoring contacts daily. So, quarantine po means quarantine of persons is the restriction of activities of or the separation of persons who are not ill, but who may have been exposed to an infectious agent or disease with the objective of monitoring their symptoms and ensuring the early detection of cases. Quarantine is different from isolation, which is the separation of ill or infected persons from others to prevent the spread of infection or contamination. Detailed considerations for quarantine can be found here. So, again, pag sinabi po natin quarantine, ito po yung pagsiseparate dun sa mga tao na na-expose sa isang confirmed case pero wala pa po siyang simptomas, no? So, ang pinagkaiba po nila ng isolation ay yun pong ina-isolate natin ay meron na po siyang sakit. While yung pong kina-quarantine natin ay wala pa po siyang simptomas na nararamdaman. So daily monitoring refers to the regular communication between the contact tracing team and the contacts they have been assigned to monitor for any signs of illness. The options for daily monitoring po, no, either direct monitoring by the contact tracing team, monitoring potential signs and symptoms by phone or visiting them in person. Contact tracers should implement standard precautions in physical distancing. Another way naman of monitoring is self-reporting, no, whereby contacts self-monitor and report them this self-reporting status to the contact tracing teams assigned to them. So, dapat po dito, if we agree with our contacts na, close contacts na self-reporting na lang po ako, dapat po may zero reporting. Ibig sabihin, daily po nagre-report sa atin si close contact sa status ng kanyang nararamdaman on a daily basis. So, zero reporting, meron o walang nararamdaman, dapat po nagre-report po si close contact sa ating monitoring and assessment team. Contact tracers collect information on signs and symptoms from each contact and a contact tracing form daily po yan, daily, up until the 14th day of the isolation or quarantine period. Why? Because this will be our basis for issuing medical certificate or quarantine certificate to these close contacts. So ano po ba yung mga issues and concern pagdating po sa close contact tracing? So as public health practitioners, we have legal requirements to act to contain a communicable disease with the broader population and also cite an ethical duty to warn individuals of their exposure. So since tayo po ang public health authorities, we should warn individuals na alam po natin na na-expose sa isang confirmed case. However, kahit duty po natin ito, infected individuals have also recognized the right to medical confidentiality, no? So the right to privacy is ika nga. So public health teams typically disclose the minimum amount of information required to achieve the objectives of contact tracing. That is, only contacts are told that they have been exposed to a particular infection, but not informed of the person who was the source of the exposure. Kasi karapatan po yun ng ating confirmed case. We wanted to address this because we wanted to maintain confidentiality and prevent the risk of stigma. The fear of loss of confidentiality and subsequent stigma, discrimination, or abuse as a result of contact tracing may discourage persons from seeking medical treatment. So, just a note po for all of us, we have to recognize that the goals of contact tracing must be balanced po with maintenance of trust, with vulnerable and sensitivity to individual situations. So, importante po na samahan natin ito ng psychosocial support services, no? Na sila po ay close contact. We are after their welfare and the immediate family members in the community because we wanted to prevent further spread of the disease. Kaya po natin sila kina-quarantine or ina-isolate kung may simptomas na po. So dapat po ito ay atin pong napapaintindi sa ating mga close contacts. Okay? So I would like to give now the floor to Dr. Nico for engaging communities and further slides na po. Siya na po mag-present nito. Maraming salamat po.
Sige. Thank you, Ma'am O. So, I'll proceed. So, very important in contact tracing is engaging communities. So, it is important to engage yung communities about the disease. So, kung paano nila iprotektahan yung sarili nila and their communities. And actually, how to suppress transmission. So, we also have to make our close contact or even the whole community understand na hindi lang tayo yung health, yung PNP, mga frontliners, yung mga nagko-contribute to break the chain of transmission, but they themselves, being in the community, by participating in contact tracing, they themselves will contribute to controlling local spread of COVID-19. So, ibig lang sabihin is they understand that yung contact tracing requires individuals to agree to daily monitoring, to be willing to report signs or symptoms of COVID-19 promptly, and be prepared to go into quarantine for at least 14 days or into isolation kung maging symptomatic man sila. It's important in communication. No? So this is actually the very challenging part, but communication about contact tracing should emphasize solidarity, reciprocity, and the common good. It's very important that we try to emphasize to the community kung ano yung magiging the importance kung bakit natin ginagawa yung contact tracing. So concerns about privacy and confidentiality can be addressed by communicating kung paano gagamitin yung mga information nila, how it will be stored and accessed, and how individuals will be protected from harmful disclosure or identification. So our recommendation here is we start contact tracing at the first instance that a suspect case is identified. So hindi na natin kailangan maghintay ng laboratory results na maging confirm sila. That way, we'll be able to prepare na if ever maging confirmed din sila, we are rest assured na nag-quarantine na yung mga close contact na to. And conduct rigorous contact tracing for all cases at the point of patient encounter. And we have to understand that it should be speedy. So speed is the key because every moment, every minute, every hour, every day na hindi natin nagagawa yung contact tracing, we are allowing the virus to actually be transmitted in the community. And very important here is to collaborate with public health authorities. So before we end, I would like to give this opportunity to have a learning session. So let's take an example for a case study. So the objective of this case study or learning session is to know kung ano yung sitwasyon. Let us analyze the elements involved. Ano yung mga issues na ma-identify natin sa case study, and ano yung mga improvement points na pwede natin gawin, or ano yung mga what could have been done. So this is an example now of a case. So noong June 1, 2020, this is example lang doon na case, hindi ito makakatotohanan. So in June 1, in San Fernando City, there's a 44-year-old male na isang frozen food vendor. No? So symptomatic siya, nagkaroon siya ng ubo, sipon, at saka halagnat. So he was swabbed. No? So on the same day, he was also advised to undergo strict home quarantine. It was only in June 5 wherein yung result ng RT-PCR test niya ay lumabas. No? And it was positive. And on June 6, it was when nag-start ng contact tracing, yung local ESO nila, wherein 12 close contacts were identified. So all close contacts were swabbed and notified to undergo home quarantine on a later date. And then it took around ilang days, like on June 14 pa, bago lumabas na naging positive pala yung mga close contact na to out of the 12 close contacts. And it is on June 16 pa, bago na-initiate yung contact tracing nung 7 close contact na naging confirmed cases. Having to identify already 49 close contacts among those 7 na nag-positive. No? So yung source of infection is hindi nila alam since Atong has no known history of exposure dun sa form to a known COVID-19 patient, and yung places visited for the last 14 days ay hindi nila na fill out. And in consequence, yung local contact tracing team can no longer catch up with the contact tracing dahil sobrang dami na ng mga close contacts na nahanap nila. Because nga, we'll try to identify some of the issues. So, what are the issues na in-identify natin? Ano? So number 1, the patient was only advised for strict home quarantine. Number 2 is there was no known history of exposure and places visited were not filled out. So unknown sa atin kung saan yung source of infection. Kasi very important, di ba, yung mga details na to kasi this is the where we take our actions also. Tapos, contact tracing was only initiated after a day when the patient was reported to be positive. And next is, it took 4 more days before all identified close contacts were notified and was advised for home quarantine by our local contact tracing team. Next is, all close contacts were swabbed. So issue rin yun, no? And lastly, the local contact tracing can no longer catch up with the contact tracing. So what could have been the improvement points, no? Or what could have been done? Number 1 is dapat Atong being a suspect that time should have been for isolation, hindi lang siya for home quarantine, no? We have to remember na once nag-swab tayo, we have sole responsibility. Now we have to isolate ourselves para wala na lang may ma-expose sa atin, mag-positive man or mag-negative yung swab test natin. So bawal yung home quarantine pag nagsaswab tayo for RT-PCR test. Next is to be able to identify the source of infection. Yung case investigation form natin, dapat nakasaad din doon na yung mga places visited for the past 14 days, dapat ma-identify natin yon. Next is, dapat we should start contact tracing at the first instance that atong was reported. Hindi na natin kailangan ihintayin na yung mga laboratory result maging confirm. As we all know, sinabi natin kanina, speed is the key. And notification of all identified close contacts should be done at least within 24 hours from the time that atong was reported. And hindi lahat dapat ng close contacts natin sinaswab, di ba? Kasi given that our testing capacity is very limited, we have to prioritize kung sino lang sinaswab natin. And very important na yung sinaswab natin is symptom-based po tayo. And with this, kung ginawa natin tong lahat na to, every time a suspect case becomes positive, kung ginagawa natin yung mga contact tracers natin, mabilis, the local contact tracing team will be at ease and will no longer be burdened since na-identify na nila yung mga close contact, nagawa na nila yung contact tracing nung pag-identify pa lang sa suspect. So, that's where we know na natin yung virus for possible transmission. So I'd also like to share no, na DOHEB with the UP College of Nursing and WHO. So this is an online training platform on contact tracing. So we'll just have to click this link para we'll be able to request for an access code na para siyang e-training kung saan we can finish this at our own pace. And mostly yung modules na nandito is it is mas comprehensive siya na form ng ginawa nating contact tracing training right now. So I would like to end with this statement from Henry Ford. Coming together is a beginning, keeping together is a progress, working together is success, and we have to remember that the strength of the team is each individual member, and the strength of each member is the team. That is why very important in contact tracing is not just the team, but we have to capacitate all of our members, and each member, mga health man yan, or what anong department man yan, very important yan paggawa ng contact tracing natin. So that would end our presentation. And if my time pa siguro, maybe we could share our 3-minute video ng contact tracing. This is actually a promotional video na ginawa. This is actually good if ma-disseminate natin within our community para maintindihan ng community natin on the importance of contact tracing. Wait lang.
Yes po, Dr. Ralph. Let's see the 3-minute video.
Yeah, wait lang pa. Hinahanap lang yung video. Give me mga 15 seconds.
Okay po, while waiting for Dr. Ralph, this will be our last presentation. So
Lubok.
we
Si
can
Willie
send
Ong.
our...
Oh, tsaka si Lisa. Ito.
Can you see my slides? The video.
Hindi rin. Matagal sila. Hindi lali lang pa sa
Hindi pa po siya nagpe-play from our end. Pero naka-share po yung screen.
Yeah, pero nakikita niya yung screen.
Yes
Thank
po.
you. Alright, I'll play it na. Thank you.
Ang COVID-19 ay isang nakakahawang sakit na dulot ng bagong coronavirus na SARS-CoV-2. Maaaring makuha ang sakit ng COVID-19 mula sa ibang tao na may virus. Ang sakit ay kumakalat sa pamamagitan ng maliliit na mga patak o droplets na tumatalsik mula sa ilong o bibig kapag ang isang taong may COVID-19 ay umubo, bumahing o nagsalita. Ang mga droplets na naglalaman ng virus...
Hello po, Dr. Nico. Hindi po ata yung screen for the video yung naka-share.
Okay, wait.
Sige po.
Yun pong specimen ng bala. Sino po?
Kita niyo ba yung screen? Sorry.
Yes po, okay na po siya.
Just let me know if may audio.
Yes, Doc.
May audio ba?
Ang COVID-19 ay isang nakakahawang sakit na dulot ng bagong coronavirus na SARS-CoV-2. Maaaring makuha ang sakit ng COVID-19 mula sa ibang tao na may virus. Ang sakit ay kumakalat sa pamamagitan ng maliliit na mga patak o droplets na tumatalsik mula sa ilong o bibig kapag ang isang taong may COVID-19 ay umubo, bumahing o nagsalita. Ang mga droplets na naglalaman ng virus ay maaari ring dumapo sa mga bagay at ibabaw ng mga gamit tulad ng mesa, doorknob, handrail at cellphone. Maaring mahawa ang mga tao kung hahawakan nila ang kanilang mata, ilong o bibig matapos hawakan ang mga bagay na may droplets. Ang contact tracing ay paghahanap ng lahat ng direktang nakasalamuha o close contact ng isang taong may COVID-19. Ang contact tracing ay isang epektibong pampublikong hakbangin upang mapigilan ang pagkalat ng COVID-19 sa mga komunidad. Ang mga taong direktang nakasalamuha ng isang taong may COVID-19 ay maaaring mahawa at makahawa pa ng iba. Sa pamamagitan ng paghahanap ng close contact, pag-uulat, paghihiwalay, at pagbibigay lunas sa mga nagkaroon ng sintomas, mapapababa natin ang bilang ng impeksyon sa populasyon. May 3 pangunahing hakbang ang contact tracing. Step 1, identify cases. Inaalam ang mga taong may COVID-19 o maaaring may COVID-19. Sila ay ihihiwalay, susuriin at bibigyan ng karampatang lunas. Step 2, identify close contacts and venues and settings. Kinakailangan alamin at ilista ang mga nagkaroon ng close contact sa isang taong may COVID-19. Ang mga close contact ay maaaring mga kapamilya, kaibigan, kapitbahay o kasama sa trabaho. Dapat matanong ang taong may COVID-19 tungkol sa kanyang mga naging gawain at mga taong nakasalumuha at mga lugar na nabisita 2 araw bago nagsimula ang kanyang mga sintomas hanggang sa loob ng 14 na araw o hanggang sa maging negatibo ang resulta niya sa repeat test. Step 3. Take immediate action. Agad nating i-isolate ang mga taong may COVID-19 o maaaring may COVID-19 sa mga itinalagang isolation centers sa loob ng 14 na araw o hanggang maging negatibo ang kanilang resulta sa repeat test. Susubaybayan ang kanilang kondisyon at bibigyan sila ng kaukulang pangangalaga. Ang mga close contacts naman na hindi nagpapakita ng sintomas ay isasailalim sa quarantine sa mga itinalagang quarantine center sa komunidad. Susubaybayan rin ang kanilang kondisyon at kung kinakailangan ay bibigyan ng karampatang lunas. Ang mga close contacts na walang sintomas ay susubaybayan araw-araw sa loob ng 14 na araw para malaman kung magpapakita sila ng sintomas ng COVID-19. I-anunsyo ang mga lugar at pagdiriwang kung saan dumalo ang taong may COVID-19 o maaring may COVID-19. Ipagbigay alam sa publiko na iwasan muna ang pagpunta sa mga lugar na ito. Bigyan rin ng payo ang mga taong pumunta sa mga lugar na ito o dumalo sa mga pagdiriwang na ito na subaybayan ang sarili at makipag-ugnayan sa kanilang local health office kung sila ay magkaroon ng mga sintomas ng COVID-19. Ang mga close contacts at mga taong dumalo sa mga pagdiriwang o lugar ay dapat ding mabigyan ng mga impormasyon tungkol sa sakit at kung paano maiiwasan na makahawa sa iba. Layunin ng contact tracing na mabilis na matukoy ang mga may sakit at close contact, maitala, maibukod, at magamot upang mapigilan ang pagkalat ng COVID-19. Ang hindi pagtukoy ng kahit isang close contact ay maaaring magresulta sa pagkalat ng sakit at patuloy na pagtaas ng bilang ng mga taong nagkakasakit at namamatay. Ang contact tracing ay isang mahalagang hakbang para sa malawakan at mabisang pagtigil ng pagkalat ng COVID-19. Pigilan natin ngayon ang pagkalat ng sakit na COVID-19. Detect, report, isolate, treat. Sama-sama nating sugpuin ang sakit na ito.
Nasobra yung sweldo ng iba eh.
Opo.
Tapos yung iba nakulang. So,
Yeah, I think that would be the end of the presentation. Thank you po.
Thank you very much po, Dr. Ralph Nico Salivio, WHO Technical Officer. Now for the last part of our activity, let's move on to the open forum to be facilitated by our Assistant Division Chief, Sir Aldwin B. Reyes.
Good afternoon to everyone. So before po tayo mag-proceed sa questions, anyone po, please prepare your questions na. Pero unahin na po natin yung mga nagtanong through chat. So kasama pa po ba natin yung ating resource speakers? Sina Ma'am Osang, Doc Ren, Sir Nico. Si Sir Robin po is nag-leave na po kanina dahil may equally important activity din po siya. Pero kung mayroon pong questions dun sa template, go ahead lang po. So first question po from the MHO of Kamiling. What is the function or what's the role of the PNP dun po sa conduct ng contact tracing? Pwede po ba nating iba to sa ating resu, Ma'am Osang? Ma'am, hello po.
Sorry, si Ma'am Osang nasa isang meeting pa. So, siguro with yung the role of PNP is to actually help out, no, in the local contact tracing efforts ng ating mga LGUs, most especially for locating, and they work hand in hand with the health department, no. So as you have seen kanina sa composition ng local contact tracing team natin, both the PNP and the health department or yung local health officer natin are the co-lead for the contact tracing efforts natin. Over.
Thank you po. So with that po, talagang makakatulong yung PNP, especially sabi nga po sa national level, kailangan ng investigative mindset pagdating po sa contact tracing. Kaya po, that's the reason na talagang kailangan yung PNP. Next question po, clarification po. In case na APOR or authorized person outside residence ang mag-positive, kanino dapat mag-coordinate or mag-update kung siya ay may visit na place? Sa place of residency po niya or pati po ba sa mga lugar na pinupuntahan niya? So in the event po na may positive, halimbawa sa LGUA, nagtatrabaho po siya sa LGUB, kanino po siya magko-coordinate? You would want to throw that question again to our Resu, Ma'am Osang or Sir Nico?
Sorry, Aldwin, pa-repeat nga ng question again. Sorry.
Yes, sir. The question is, in case po na yung mag-positive ay authorized person outside residence, meaning nagtatraverse siya ng multiple LGUs, kanino po siya magre-report? Doon po ba kung saan siya nakatira or doon sa mga LGUs na kung saan siya nagtatrabaho or naglagi?
You mean ba yung APOR yung naging positive?
Yes po, authorized person siya outside residence and meron siyang mga iba't ibang mga lugar yung kanya pong mga pinupuntahan siguro in the nature of his work. Kanino po siya unang magre-report or magno-notify?
Well, basically kung saan yung, 'di ba, we usually use kasi the current address of the individual. So most probably yung coordination should first come from the APOR na nag-turn out to be positive to the LGU kung saan siya nagre-reside. Then the contact tracing naman would be in coordination sa mga places na that person could have visited. Parang ganun.
Noted po. So that's a clear answer para po dun sa query of DILG Aurora. Thank you po. So now we will accommodate kung sino po yung mga meron pang mga questions. I see someone po. Opo, F5 Liza. Nagtataas po ng kamay. You are now recognized. Pwede na pong mag-unmute. Or are there anybody who wants to raise their clarifications or questions po sa ating resource speakers? Most po ng mga chat ay nanghihingi ng presentation. Meron po kaming i-flash mamaya on where you can download the presentations. Pero sa latter end na lang po. For now, let us proceed. From San Ildefonso, alam po natin na risky ang pagiging contact tracer. Pero ma-ask na po namin kung may allowance po ba pag naging contact tracer. Thanks po. Anybody from our resource speakers may answer?
Siguro that would still depend siguro on our local government units, especially for our local contact tracing team. Siguro si Doc Renly, if nandyan, she could share some of her experience with regards to their local contact tracing team sa San Fernando, if meron man silang allowance na nabibigay.
Sige po. Doc Ren, are you still there? So again, the answer po varies talaga dun sa capacity of the LGU. Likewise, sa national level naman po, merong nakaplano, perhaps na balitaan na rin po, na the government will hire thousands of contact tracer. Pero we're still waiting for the guidelines po noon. Dadaan po yun through the ILG. Are there any other questions po or clarifications? Okay na po. Last call po. If you want to raise any questions. Sige po.
Si BFP Bulacan po nagre-raise. BFP Malolos.
BFP Malolos po. Sige po.
Sir, siguro sa akin po yung ating mga kasamang doktor po na member po ng contact tracing team. Siguro yung ulitin lang po ulit yung mga do's and don'ts ng mga contact tracers kasi yun nga po, delikado na sila po talaga yung maharap sa sa mga pagbaba nila no? I-trace nila yung mga yung mga COVID, possible na COVID, suspected COVID infected po. No? Yung mga do's and don'ts po sana, yung mga contact tracers po. And then, ang naisip ko kasi yung proper PPE para po sa sa mga contact tracers natin. Like mask, gloves, ganyan sir. Yung mai-alimsan natin sa kanila na dapat talaga bago sila alis team. Ito yung dala-dala ng PPEs. And then alcohol, syempre, dapat meron din po silang dala-dala. Kasi yung naiwasan, baka may mahawakan silang mga Ganun po sir, iyan lang po sir yung gusto ko pong dun sa mga doctors po natin na maulit
Okay.
yung
Thank you so much po, sir, from BFP Malolos. So the question is, yung proper PPE and protocols dun sa pagko-contact trace, given na this is a risky job, tama naman po kasi yung mga suspect cases po, yung hinahanap po natin, and yung mga contacts po nila. So ano po ba yung mga dapat na precautions na meron sa mga contact tracer na bababa po sa field po natin? Sir Nico or Ma'am Osang?
Yes, sir. Sir, siguro with regards, I think si Sir from BFP is also asking for we could provide siguro some information, infographics for the do's and don'ts. But to answer siguro din the question is, of course, being in contact tracing poses a lot of risk. And for the PPEs kasi, what we could use for during contact tracing is practicing the IPC protocols like wearing the mask. I think wearing the mask is already okay na po yun. And then of course we also have to maintain physical distancing always. And we always make sure that after our field work we practice our proper hygiene po during and after field work po. And siguro we could provide some infographics para doon para minsan maganda din kasi na at our level sa local natin meron tayong mga din na nakikita na kahit saan lang, like for example in our offices, na these are the things that kailangan natin gawin while we do our contact tracing din.
Okay, thank you po. So hindi naman po kailangan naka-overalls po tayo sa contact tracing. Sabi po ay the mask, tapos proper minimum health standards sa social distancing and proper hygiene would suffice sa perspective po ng healthcare dito po sa pagko-contact trace. Do we have any other questions? Nagre-raise po ng hands. Balut ay Pilar. Balut 1. Tsaka po Oppo F5 Lisa. Meron po ba tayong questions or napindot lang po yung reaction? Mukhang it seems like the latter. So do we have any other clarifications po? Bago po tayo mag-proceed sa ating next agenda. Mukhang okay na po. So with that, nandyan naman po lagi yung ating resource speakers. Isang coordinate lang po sa ating mga DILG officers, sa ating CMHOs. For sure, ginagawa na po nila yung contact tracing and meron na pong operational knowledge dito po sa ating topic. With that, maraming salamat po and let me turn over the floor to our MC, Miss Jeannie.
Thank you very much, Sir Edwin. At this point po, for the last part of our activity, for the closing message, we have our Division Chief of the Monitoring and Evaluation Division, Ma'am Larry S. Hernandez.
Magandang hapon po sa ating lahat. It was a very fruitful afternoon for all of us. We have learned something new At na-affirm natin na ang importansya po ng napakahalaga ng papel na ginagalawan ng ating mga contact tracing team. Actually, sa iba, this is just a review, but dun sa iba, marami sigurong mga nakuhang information since nagbigay tayo ng mga proseso, nagbigay ng mga sample, si Dr. Miko at saka si Ma'am Osang, as well as we have presented to you the best practice na pwede nating maging gabay or magaya po sa ating mga locality. At sabi nga po, as laging sinasabi ng aming boss, pag kami ay nagko-conduct ng Regional Interagency Task Force Screening and Validation Committee meeting, time is of the essence. Napakalaga po ng oras na ating makita at mahanap ang lahat ng naging close contact ng isang naging infected po na individual. So, at sabi nga, napaka-risky rin, but this is one of our role na dapat po natin galawan para makatulong tayo sa ating komunidad at makatulong tayo na maiwasan po natin ang pagkalat panlalo ng COVID-19 sa iba't ibang lokalidad. Ano po. And then, napakahalaga rin po na natutunan natin na may mga best practices pala tayo. Baka sa inyo po, sa susunod na panahon, yun na yung aming mga iimbitahan na para mag-share naman ng mga best practices ninyo sa paggawa po ng trabaho natin bilang contact tracing team. Di po ba? And at the same time, napakahalaga rin po ng pagre-report, ang tamang pagbibigay ng datos at ilagay po ng tama dun sa mga reports. Kaya rin po, inarapat namin i-present din sa inyo kung paano talaga yung contact tracing report. Kasi po, itong contact tracing report na po ito ay napakahalaga po para sa ating interagency task force because this will be their basis para po sa zoning containment strategy, not only at the local level, but ito po rin yung pagdideklara po nila ng mga zoning containment areas po sa iba't ibang lalawigan po natin. So, napaka-importante po ng role natin, napaka-importante rin na tama po yung pagre-report natin. So, siguro, magtulong-tulong po tayo. Lagi nating sinasabi, time is of the essence. At nakakalungkot man po sabihin na araw-araw napakalaking bilang po ang natatagdag sa mga infected. But siguro po sa pamamagitan po ng ating team sa local level, mas makakatulong po tayo na mabawasan po ito. So bilang mga contact tracing team members po, na napaka-risky ang inyong magiging role. Lagi po tayong mag-iingat at isipin po natin na ito'y ginagawa po natin, hindi lang po para sa ating sarili, kundi ito po'y para sa bayan at sa mga susunod pa pong henerasyon. Maraming salamat po at mag-ingat po tayo sa ating magiging trabaho. Pag ginawa po talaga natin ng tama yung ating mga roles po bilang members ng contact tracing team po. Magandang hapon po ulit sa inyong lahat.
Thank you po, Ma'am Larry. And for those po who are asking for the copies of presentation, we will be flashing sa ating screen ang link kung saan niyo po sila pwedeng ma-access. So if ever po the presentations or the materials are still incomplete, we will be updating the link up until tomorrow. Pero dyan po natin sila pwedeng ma-access. Again, thank you very much po sa ating mga speakers and sa ating mga participants. For those po who weren't able to attend, we will be still having the second batch tomorrow. And same link for our materials. Marami pong salamat.